Welcome to our special meeting of the Ad Hoc Committee on Chronic Inebriation. We have some very special guests with us from the lower 48 today to share their experiences, and we're very grateful that they've taken the time from their trip up here to spend this hour with us. If we can go around the main table and just have introductions for the record. Start with you, sir.
I'm Gary Olson. I'm the CEO of the Center for Alcohol and Drug Treatment in Duluth, Minnesota.
Phil LeBeau, President of LeBeau Development.
Nancy Burke with the Alaska Mental Health Trust Authority.
Michael Gozzi, I'm the CEO of American Indian Community Development Corporation in Minneapolis, Minnesota.
Tony Cassell, contractor with LeBeau Development.
Jennifer Johnston, Assembly.
Bill Evans.
Tim Steele.
Amy Domboski.
Pete Peterson, Assembly.
Dick Drain, Assembly.
Great, and so not to waste any more time, we're just going to turn it over to Nancy, and you can take it from there.
Thank you, and I appreciate your allowing me to just do a small introduction for the work that the Mental Health Trust Authority has done, and by way of explanation of how I've been knocking on people's doors like these people at the table for nearly 10 years now, and I'd like to share some of that work with you first and not take a lot of time because we want to maximize their time, but just to provide a little background. So as you know, the Alaska Mental Health Trust Authority has beneficiaries who are people with mental illness, developmental disabilities, chronic alcoholism, and other substance-related disorders, Alzheimer's disease and related dementia, and other cognitive conditions such as brain injury that have a lifelong impairment on cognitive functioning. And so as these beneficiaries, we understand to be some of the folks who more frequently fall into homelessness and more frequently stay in homelessness. We have been investing in housing in a focus area since about 2005. We initiated our housing focus area. We have other focus areas, and this comes from a presentation that we've been doing to prepare our trustees to talk about another matter, Medicaid expansion, and some of the service funding that is available for operations. And as you see, the areas that are highlighted in blue, these are other focus areas that we have, but these areas have Medicaid and state resources as their underpinning for financing of the services. And so this conversation that's going on statewide around Medicaid is a very important one, and I wanted to highlight the ways that it trickles down to communities for you today. These are the Trust's main priorities in the legislative session, which we're in our legislative session right now for our visitors. So it's an exciting time for us to be able to communicate to the legislature about our priorities and what we're working on. When we started our focus area in 2006, one of the things that we were pretty hopeful about doing is taking a look at this continuum that you see below and looking at the places where there might be room for development. We're very excited about getting some numbers, and we know from other communities that there should be percentages of housing available for people who might be our trust beneficiaries. We know that maybe 10% of units across communities should be affordable housing, which is for your low-income workers, your retail workers, your direct service workers. And then a percentage of those need to be available for supported housing for people who have disabilities so that we can maintain them in the community and comply with such things as the Americans with Disabilities Act and the Fair Housing Act. And so we were very excited to look at this continuum and to start maybe identifying places where we could do development work in each of these colored boxes that you see. But rather what we saw was a really severe lack of one type of housing, and that was the most intensive housing. And for people who had chronic addictions or long-standing addictions and were on the street, if you call around 2009 and 2010, we lost nearly 30 people in Anchorage, Juneau, and Fairbanks to exposure, dying from exposure on the street. So we really started focusing on housing first as a strategy, which brought me to connect with these colleagues. And I'm not going to go into the housing strategy so much because that's the basis of their presentation. But I wanted to highlight some more of the financing work that goes around with that, because you have to focus on both sides of the equation. There's a housing piece and then there's a services piece. And so just a brief explanation of our services piece. If you think about Medicaid, it really formed around a health program. It was initially created to support people coming back from the Civil War and who didn't have arms or legs, and so it was a way for those folks to have access to healthcare services. And as it's grown and changed, and there have been significant changes in the way that we understand services, the Americans with Disabilities Act was one of the most significant changes that pushed Medicaid out into communities to now support people in communities. And we in fact had directive to provide services in homes and local community areas rather than collecting people into institutional settings. So as a result, Medicaid in some places, Alaska is one example of a place where we have not taken advantage of some of the ways that you can use Medicaid a little more effectively in community settings. We're still a pretty straight up fee-for-service Medicaid model. You get this dotted line that happens. So people will do well in institutional settings and in more structured settings that are institution-like, including assisted living. We have either state general fund dollars or we have Medicaid dollars that cover those services. Where you see the dotted line is where we see people falling out of service. When people are discharged from institutions, they come out of jail, they come out of API, they come out of assisted living. Medicaid doesn't work as well. It's harder for providers. We have a 15-minute billable increment that we have to make work for such things as employment and transportation, and we could probably do a whole assembly session on this slide. I'd be happy to come back and do that. But I'm just, suffice it to say, it doesn't work well where this dotted line is for a number of reasons. And then as people are able to make it to the clinic, so if they're able to have a job, if they're able to maintain an apartment and stable housing, they can use public transportation and they can get to the clinic. Medicaid picks up and it works pretty well then again. But it's this dotted line that really represents the increase of the people who are on our street that are visible to us and that we're trying to address. Just to give you one of the outcome slides, this is a Bridge Home program, which is the underpinning for the current assertive community treatment teams and the intensive case management. We started with two efforts. We did the Bridge Home program in 2006. This number is 2010. This is what happens when we're able to provide supportive services. We augmented the Medicaid billing in that dotted line area with about $1 million for trust beneficiaries through our grantee, Anchorage Community Mental Health Services. The $1 million wasn't all service dollars. It was some of staffing. It was oversight for the program. So starting in about 2006, we've been working on this Bridge Home program. That was the program that we were beginning to transition into an assertive community treatment team. And at the same time, we'd been doing a parallel for people who had chronic addictions on the street. The service providers were running a similar effort through their outreach with Carlick Manor and through the federal SAMHSA grant that benefited the homeless called the CABI grant. So we'd been doing these models of trying to be more responsive, help people make that transition, make Medicaid stretch better, work better in that dotted line area since about 2006. Then in last year, when the commissioner decided to utilize some of the resources that were available through advocacy of the local community, those funds went into really launching the programs up to a scale that we can now hopefully see the benefit. So we have 100 people targeted through the assertive community treatment team. We have the next 50 people after the Carlick. If you remember when we did the vulnerability index, Carlick was the first 46. Now we can reach down to the next 50. And one of the things that when I was addressing you during the alcohol tax meeting, one of the things I'm hoping we might do is we might just take that list. Let's just work on that list and let's see if we can't turn the curve. So we have 100 people on ACT, we have 50 on the intensive case management projects. How can we bring other programs that exist within the state to bear for the next people on the list? And let's start really just going after the issue that we have that way. Let's just do it. I think the resources are in place. And if the community does want to revisit another revenue source, if we had some alcohol tax income, or if we maybe programmed some of the other federal fund community development block grant, maybe home funds, I think we have some resources that we can really begin tying to these efforts. But it's critical that we leverage what's happening. And I don't want to take much more time, but I want you to know that Medicaid expansion is a very important thing. I'm just going to show you one slide here. You have these slides so you can read these in your time, and I really want to make sure our guests have the most time today. This slide is what is so critical about what's happening with Medicaid expansion. currently, before we expand as a state under Medicaid expansion, you need to document that you have a disability. And the Social Security Administration does not allow alcoholism to be your primary disability. And so one of the things we found, a lesson learned from Carlick Manor, was once you get the folks on the street that get labeled chronic inebriate, once you get them in and you start the diagnostic process and the application process for Social Security, which can take up to a year to be consistent and file the paperwork and follow it through, you start seeing that the alcoholism is probably the most acute, it's the most present diagnosis, but underlying that there are brain injuries, there are mental illness, there are learning disability is a huge one for some of the folks. When I first started working in the 80s in Anchorage, I worked on a program with people who were marginally developmentally disabled, so they had a learning disability. There are 6 of those people from that agency in Carlick Manor. So we're catching people who just are not making it in the system. The expansion takes this out. The expansion bases eligibility entirely on income. So anyone who's in this income bracket who is eligible for Medicaid under expansion. That means all the people who have the primary diagnosis or the most acute diagnosis of alcoholism will now be eligible under the Medicaid system. This is huge. It brings all kinds of new operating revenue. And so this was my point during our assembly talk, that if we can begin building the infrastructure, if we can provide the vehicle for the services to be effective, now's the time. I think we can do it. So I'm going to hold off on the rest of them. I have some other slides here, but I'm going to allow the time for the visitors. And if you would like, I would be happy to come back and we can have some more dialogue.
Hi.
Take it away, you guys.
All right. So I'm coming in a little bit. I don't know what you know about us, if anything.
Some of us know some, and some of us know a little more, so why don't you see if you
Okay.
give us a brief.
We'll do a quick introduction. So my name again is Zola Bo. I have a small consulting company. I've been doing homeless housing work for 21 years, everything from direct service to somehow running a big nonprofit that served homeless families and individuals, development, the whole 9 yards. I worked for a national nonprofit for about 7 years, and that's how I met Nancy. That was my primary focus was working with urban Indian and tribal communities as well as rural communities and nonprofits around the country to do basically housing first, to do permanent supportive housing. So was involved a little bit with Carlick and with the project in Fairbanks and have just recently came back. But Mike, you want to introduce yourself?
Yeah, again, excuse me, got a little cold in the cold weather. I'm Mike Gozzi. I'm the CEO of American Indian Community Development Corporation. We've had a housing first model for 18 years. It's known as Anishinaabe Wakayagan, which in the Ojibwe language means people's home. And we started with a 40-unit building. We've now increased it to 45 unit, and we're actually building another 32-unit building to increase the continuum of care for the folks that we deal with. Our program has been very successful, been duplicated all across the country and into Canada. We prove on a regular basis that we save the county and the state dollars and cents, and we provide a quality of life that some of the folks have never had throughout their time here. And so.
Oh, thanks. Again, I'm Gary Olson, CEO of the Center for Alcohol and Drug Treatment. I started with the center about 42 years ago when we opened our regional detox program. You know, sometimes we hear Minnesota, the land of 10,000 treatment centers. I mean, we really we led the way with addiction treatment, and so when I started working in detox, within a few years it became evident that not everybody was responding to the Minnesota model. So a lot of people were getting better, but some folks weren't, and they tended to be people with dual diagnosis, minority populations, people with a variety of other conditions, but primarily mental health disorders. And in Duluth, we were a town with a lot of loggers and miners and merchant seamen, and had a long history of chronic public inebriacy. Most cities in the United States have a population. It's a problem that's gone back for many years. beginning of this country, actually, chronic public inebriacy. And so about 1975, I started talking about the need for supportive housing, but really the problem got worse. They started tearing down all the old flop houses in Duluth, so we had, we used to have casual labor, and people were not always homeless. They could make a few bucks and get a room for a week, so they weren't always homeless. And then they started closing the state hospitals, the big institutions. And the combination of those two well-intended policies forced this whole population of homelessness, and people started dying like they were up here, dying on the street, and weren't getting well. So supportive housing really was a response to the need to provide stability, because homelessness is not a treatment plan for addiction. Whatever addiction makes bad, homelessness makes worse, and people don't live very long and don't get better. When provided with stability, people get better. But the real payoff for the community was a reduction in detox admissions for that population in the San Marco, which is the name of our program. 95% reduction in detox admissions, 90+% reduction in police contacts, 60 to 70% reduction in emergency room visits. They just didn't need to go there anymore because they weren't using detox for emergency shelter, they weren't using the emergency room for routine medical care, and they weren't using law enforcement as a taxi cab service. So we basically got a lot of support, had to demonstrate the project. It had a lot of opposition. People don't understand about this. They say, well, you're letting people drink, and it's like, no, I'm not letting anyone drink. They're adults and it's legal. So, but we demonstrated those outcomes, and that helped really get community support. So we've now developed programs in St. Cloud, Minnesota, Rochester, Minnesota, and of course in Anishinaabe, Waukegan was already up and running. So we've got a number of these programs around Minnesota that have really been able to demonstrate really effective outcomes for the community, but also effective outcomes for the individuals in the programs, and those we can talk about very specifically. But that's really, it's about dealing with public inebriacy that this whole project, and from my perspective, got underway. So.
Okay, one more. So I was actually maybe mistakenly asked to speak to a group of city planners and city managers from around the state of Colorado who had identified that their #1 issue was homelessness in the downtown corridors and cleaning that up. And so I'm just going to say kind of the same thing here that I said to them, which is really permanent supportive housing and a housing first model is the only thing that works. You know, in Colorado, they wanted to do camping bans, and they thought that ticketing people was going to work, and it just made the problem worse. So I'll just kind of start out with that. And just so that we all are on the same definition, permanent supportive housing is basically housing that is open-ended, so people can live there as long as they need to. It's affordable, so there has to be a substantial operating subsidy that's raised, because people don't pay any more than 30% of their income for rent, and many people coming into these buildings won't have any income, especially to start. It's independent as possible, so this is not housing where you'll be kicked out if you don't follow some pre-prescribed service plan. It's not assisted living, it's not a group home. There are intensive services on site, but the way that we look at it is the onus is on the service provider to provide a very intensive, attractive package of services rather than on the client to accept some pre-prescribed plan for services. So that's the basic definition that we're working from, and that's kind of the federal best practices and the state's definition as well. So housing first, I think you guys have been hearing a lot about this. I'm not going to read this really intense, long definition, but what I will say is it's really, really simple. It's get people into housing. Get people into housing, get them to feel stable and safe when they're in housing, and then start working with them maybe on some of the other issues in their life. I think that, and I don't know if Mike, you want to comment on some of the outcomes that you've seen around putting people into housing?
Yeah, you know, just off the top of my head, you know, people come in at pretty much their lowest point. They're homeless. A lot of them have separated with their families, separated with their communities. You can see that down here in talking with the clients at the program here, that they left their village, and there's not much contact going back and forth. And so to bring people into a house where first you can stabilize their housing, they have a place to go, you know, and we offer services available. We have case managers, just like the program here does, Scarlett does. And we work with them fairly intensely on what's their goal. You know, creating a goal. If people do not have a map, they're going to be lost. And so we look at mapping a goal, and it might be very simple in their goal, but it's a direction of moving forward that we choose to do. Over the course of our time, we've had 5 people that actually have come back and worked for us as an opportunity because they didn't have a work period or a work history for a long period of time. So nobody would give them a chance. And so we brought them in to give them a chance. We work with them, and they've been sober for a long time. They're really motivated to help themselves and help their community. And we give them a chance, they start with us, and all of them have moved on to work for the county, the city, and other organizations and companies. And so we see that by giving people an opportunity and keep pushing that bar up through the case management and through the support, you get them to a point that they wouldn't have gotten to otherwise. And so our benefits that we know and we prove it on a regular basis is shorter periods of drunkenness, all right? So somebody that was drunk 30 days a week, a month, might be drunk 2 days a month. You know, binge drinking. Instead of being gone for 5 days, they're gone for a day and a half. Then they come home. Better mental health, better hygiene. We work on really, we talk about rehabilitation a lot. Sometimes it's habilitation, getting somebody to that basic level. And in mental health, regular health, we have a doctor on staff, and so we help with medication management and, again, creating a plan for better health.
And I think the bottom line with Housing First is that homelessness really is ultimately a death sentence. And so if we really want to solve it and save people's lives, we have to provide housing for people and keep them there. So.
And I put this slide in there. We were given a list of agenda items to try to cover in a short period of time. And I just put this in there to illustrate exactly like what it says at the top. The cost of doing nothing is absolutely not nothing. And to show some of the expenses that cities incur with the same folks who would be benefited by permanent supportive housing. And as you can see on the far left-hand side, the cost of permanent supportive housing is about on par with that of an emergency shelter that does not have the comprehensive services that supportive housing does. And when you look at the services, the crisis management services often accessed by folks who have no permanent residence, that they're often quite higher as you look at the hospitals, mental hospitals, jails, and as Gary and Mike had mentioned, the frequency of detox visits. So again, just to show kind of the cost-effectiveness strategy of permanent supportive housing for a community.
That just kind of shows where you're spending the money. The people are going to use the services. And so it's a redirection of funds that you're going to spend regardless of whether or not you improve their lives or not. And so it's a way of improving lives and actually is a cost-saving measure. We know that every year I have to prove it. 1 year, a person lived 6 months on the street. In those 6 months on the street, he did 63 admissions to detox. All right, our detox cost is $259 a day. All right, and most of the time he got there via the ER, and so he was picked up on the street for falling down, cracked his head open. The ambulance picked him up, took him to ER, put a Band-Aid on his head, strapped him on a gurney, put him in the hall until he was sober enough to let back on the street. All right, and that cost, when I did it in 1994 as a CD counselor at Detox, was about a $2,000 day for a chronic alcoholic who got out, fell down, wound up in detox, and wound up in ER, wound up in detox. And so we were able to prove that we could do that. That same individual with 6 months, 63 admissions, in the 6 months at Waukegan, he had 3 admissions to detox. And so the savings that they had in 1 month paid for his housing for several months, as an example.
Ms. Johnson has a question.
Yeah.
You have the experience that I'm familiar with where you went from the late 60s to now, and we had mainstreaming. basically closing down of all the mental hospitals. And do you have any of the statistics from back then in the cost versus pre-supportive housing and post-supportive housing? Because it would be interesting, particularly when you're looking at federal funds and how it's addressed, and as you're making your cases.
No, I really don't, but I think the closure of the large institutions was driven by other factors, and primarily because the institutions were housing people primarily with mental illness, and the public inebriety in our community used to winter over in the state hospital. That was how they got out of the cold. So for them, it was really housing. I mean, they knew the syllabus of the treatment program better than the counselors that worked there, so that wasn't really very effective for them, but it was at least kept them alive. And you know, the cost of those institutions was never very well established, because there was a lot of capital investment in those institutions that the state had expended many years before, and buildings were fully depreciated, so it's kind of hard to compare the costs. But you know, there was kind of a system that had evolved, and this was prior to the decriminalization of public intoxication. What would happen is people would be picked up, they'd go to the drunk tank, they'd be convicted, they'd go to the work farm, they'd be at the work farm, then they'd be back on the street, so there was kind of this revolving door. And then after decriminalization, we had the detox, they'd go to the state hospital, they'd get back at the street, then back at detox, back in the state hospital. So what I call a padded revolving door, but the purpose of it was not about treating alcoholism. The purpose of decriminalization was that it was clogging up the criminal justice system. About half the arrests in the United States in the mid-'60s were for public intoxication, and it was undermining the whole criminal justice system. So that's why the federal government pushed for decriminalization. I'm not sure if that's...
Some of it, the other part was the mental illness of the homelessness and the treatment of alcohol for mental illness. So you had that added impact of having the homelessness increased by mental instability.
Yeah, I mean, it's a case that, as Nancy was saying, a lot of people that are public inebriate, chronic alcoholic, do have an underlying mental health problem. Not all of them. There's also trauma issues that are unrecognized. In fact, in my 40-some years experience, I would say that childhood trauma is probably the one common denominator for difficult to treat addiction. You understand that this is only a tip of the iceberg of the population with alcoholism, and in fact most alcoholics recover eventually with or without treatment. So we're talking about people that are not recovering, and there's usually some co-occurring issues, and ultimately what kills people really isn't their alcohol use, it's untreated medical conditions, it's violence, it's exposure, it's those kinds of things. So the supportive, stable environment is what allows people to begin accumulating some what we call recovery capital, because these are recovery environments. They're not relapse environments. I have an ongoing debate with my friend William Moyers, who works at Hazelden, Bill's son, and he called these facilities, he compared them to crack houses. He was a crack addict. So he said it's like living in a crack house. Well, no, it's not like living in a crack house. It's not like living in a frat house. There are, I always use Cesar Millan, the dog whisperer's term, that we have boundaries, rules, and limitations. So it's a structured environment that really supports recovery, even if people aren't in recovery. So we're surrounding people with supportive services, and Mike will attest to this. Every year we have a few people that move from the board and lodging facility, the supportive housing facility, to sober living, because they experiment with sobriety without the risk of losing their housing. So they have these opportunities to do that. We have sober activities, and so we're actually creating a recovery environment. My agency is one of the third largest treatment provider in Minnesota. We're all about treatment and recovery, and we support recovery. But not everybody is going to respond to that, certainly not the first time, and sometimes not after 3 or 4 times. So we want this to be a recovery-oriented program, even if people are not in recovery.
I think Mr. Steele has questions in this group.
Yeah, I guess mine's just an observation in terms of the thing we seem to be struggling with is that first phase, of assisting people to get to be able to live independently. and finding, we've tried a couple of projects out in the community that are larger projects, and the community gets all excited and upset and ends up scuttling the program. It's just getting that Carlick Manor-like facility to help people to get to that assisted living, or that more independent living.
You know, a lot of times it's, we've had a lot of residents that, because of the advanced stage of their alcoholism and other medical conditions, move from the supportive housing into assisted living or some more intensive level of service, but they would never have been able to go from the street into that level. They would never have made it without learning how to live in a more structured environment. So for some people, it's a stepping stone to a higher level of care, actually. But that's the beauty of it, is that you can really help move people to whatever, I guess, optimal outcome is possible given all of the circumstances. But it's difficult to sell. Yeah, it really is. Yeah.
So I would just make a comment about that. You would be hard pressed to find any community around the country that would welcome with open arms one of these projects. And quite honestly, you just have to get thick skin about it. And you just have to know that you are going to have people that get upset, and you have to be respectful if they're making a rational argument. And then at some point, you just have to tell them to go away. Because most people, not most people, a lot of people that get upset about these, it is not a rational argument that they're making, because we're making the rational argument. We're showing facts and figures. We're going to show you beautiful buildings that help communities. So you really just have to do that. And I will say that I have, in projects I've worked on, we will also use fair housing law if we have to. So if we have cities that deny zoning based on, housing these crazies, which is what we hear from the neighbors at neighborhood meetings, the Attorney General will come in and tell the city that they cannot discriminate based on disability. So there are some different tools that you can use, but it really comes down to just making this a priority and being willing to deal with a little bit of the fallout.
I'm sorry, I neglected to tell you that one of the tasks that our technical assistance people are doing in this visit is doing a review of the model in each of our locations. So we have Anchorage and Fairbanks online right now. Juneau will hopefully be constructing next year their project. And I think one of the things that's been very encouraging to me, having been with this advocacy for this type of model from the beginning, is now people are accepting it. There's still some questions around whether or not treatment is happening in the units, or if this is enabling behavior. I saw yesterday in the paper it was referenced that people stay there free. People pay rent. They have to pay 30% of their income. Some people come in with no income, and I know Rural Cap has some practices around using voluntary labor as, so people are contributing. And that is essential. That's the key. People need to feel like they're being integrated and welcomed back into community. And the way you're in community is each person is contributing. So they'll be doing a review of each of the facilities, and one of the things we want to do together with a lot of stakeholders is develop some parameters, that this is what a Housing First program does, and this is what we want to see from them. So I neglected to tell you the purpose for their visit.
About support, we have the luxury of being in business a longer time, and so people have the memory of what it was like and what it's like today. And so when we present to, whether it's the city council or the city or associations, we have residents, because my facility is in a neighborhood. So it's not in a commercial spot, much like Carlick is. And so we have real people next to us and real families. And the real families had to put up with the inebriate population before there was housing with no place to turn to. And now I go there and I get their support. They come and they speak on behalf and they say, well, I remember what it was like, and I didn't like people peeing in the street in front of my house, in front of my kids, or doing this or doing that. And now I know this is better. Our biggest supporters are the police and the ER, because they see the drastic reduction in their time with this population. both in the beginning and as they progress, because they know where they can take them. They don't have to take them and book them or take them to the ER or take them to they take them back home because they know them now. And so it becomes really a fabric in the community, given time and given support and the opportunity to do the work they do.
I'd just like to mention, just in full disclosure, that it probably wouldn't surprise you to know that not everybody makes it in these facilities. They can't follow the 5 simple rules. I mean, there's 5 rules, but they can't follow them. And so in Duluth, for example, we've developed some other strategies, because I wouldn't want anyone to think that this is like a magic bullet. But when I look at, so there are people that don't make it, and I can talk with Nancy more about our community intervention group, which is our strategy for dealing with the people that can't make it. But you have to think about what is called the Pareto principle, the 80-20 rule. 20% of your population will result in 80% of your utilization of services. So if you're able to target an intervention at that smaller group, you get a disproportionate positive impact in the community. So in detox, about 15% of the population accounts for about 75% of the admissions. And so when you provide this alternative, it has a huge impact on detox. So you're getting a big bang for the buck, so to speak, but you're not solving the whole problem. You still need some parallel strategies. You need enforcement, you need detox, you need treatment, you need prevention. So you really need to work on multiple paths as a community to kind of manage this difficult problem. But you're not alone. Every community of any size has some version of this same problem. And visiting the residents, Mike and I spent time with the residents in Fairbanks and here in Anchorage, and it was just like being in Duluth. I mean, it's like the same people and the same conversations, and so very, very familiar. It's a almost universal subculture problem in cities, and we pay for it, as Mike says, one way or the other. It can't be ignored.
This next slide looks important, I think.
Yes.
But before that, I do want to announce that Mr. Hall has joined us, so we're going to start from the beginning again.
Mike.
And Ms. Gray Jackson has a question for you.
Thank you, Mr. Chairman. And thank you for mentioning the fact that not everybody makes it to House first. And it's because they can't follow the 5 rules. And you may have mentioned 5 rules, but can you mention what the 5 rules are again? I'd really like to write
If I can
them down.
remember them all, I mean, that's the problem with having a lot of rules, is how many can you actually remember. But no violence, treating staff and other residents with respect, paying your rent on time, not destroying the property, and
No illegal.
what's that?
No illegal activities.
And no illegal activity. Those are the 5 rules.
Okay, thank you. Thank you, Mr. Chairman.
Thank you. Financial feasibility.
All right, so I'm just going to touch on this. So in order to make these projects successful, and I've seen a lot of them that aren't around the country, not here, they're doing an amazing job here, by the way. But you really have to have 3 sources of funds, well, you need more than that, but 3 budgets. You need your capital. How are you going to build your building, right? How are we going to build, or how are we going to rehab? You need operating, so you have to have an incredibly deep subsidy, because you're dealing with people that cannot pay rent, and this has to be a subsidy that goes on forever. And you have to have supportive service funding. And I will say that you figured out a way here in Alaska to build these buildings. There are some challenges around the ongoing operations, and I think that is something that hopefully we would be able to work with the state with at some point, and we would get support from local communities, because it's a really important issue. Nancy touched on the Medicaid. Medicaid really is the silver bullet, so to speak, for providing services in these buildings in a way that is financially solvent. It is extremely difficult and complicated. There are really smart people in the state who are working on it right now. But ultimately, that is the way these services should be funded, and that is the way that it is being done. In some parts of the country, it's just extremely time intensive. But I just wanted to mention this because you cannot do it. If you don't have a stable source of operating funding, your project is going to fall apart. And the projects that I see that fall apart are because they don't have that. They don't have the supportive services. So that's something as a state that the state is going to need to model and really come up with a better solution. I think that people are trying and they're cobbling what they can right now, but there really has to be a state-driven, really solid business model. Okay, next. So I'm not sure what you wanted to hear exactly on site selection. Obviously, you want to get a site that's as clean as possible, meaning not a lot of environmental issues or potential environmental issues. You want to make sure that it's in a good location. The folks that I think you're looking at targeting for additional housing first are probably mobilely challenged in some cases, partly because of the inebriation. You don't want them too far from downtown, but you probably also, would like to have them maybe a little bit adjacent, but not too far, because otherwise you're going to have problems. Obviously, the cost is an issue. One of the things that I've seen cities do and be really proactive about who have been successful in this type of housing is the city really take on finding the location, making sure that it's clean, and basically turning it over to the developer who does this type of housing or the nonprofit. That is a huge role that the city can play. Cities have resources and capacity around this issue. They shouldn't be developers, because that's the developer's job. But to find either a building or a site that's clean and appropriate and paying for it and turning it over to the developer would be a huge deal for the city. So that is something that I would think about if I were you all. Doing an analysis of the regulatory restraints. Obviously, we don't want to get into a zoning war if we don't have to. I mean, if we have to, we will, but it'd be nice to have the zoning zoned correctly. Again, making it sure it's close to services. Go ahead. So Mike and Gary are going to talk about what we did in Minnesota.
That's
we have
Gary in
about-
the middle.
About 15 minutes left.
Oh, we do? Okay.
So, including time for questions. So.
Okay. Oh, okay. Go ahead.
Go ahead, Gary, this is your places.
So I'm talking about the San Marco. The San Marco is the building down here, and as Zoe said, in Duluth, of course, it was a challenge to locate it, and I have to be honest, I played a little bit of a chess game with the city over this. I had developed a property right on the main intersection of downtown, which was the area that was targeted for redevelopment. It's a primary tourist area. And we already owned the building, so I said, well, I think we'll do our Housing First project there, knowing that everybody was going to be outraged, like pitchforks and torches. And so I said, well, if you don't want it there, it needs to be within this geographic area, because people always want to move these projects somewhere outside the city. But these are voluntary projects, and in Minnesota, everybody pays their rent. So if a resident has Social Security, that entire check goes to help pay the cost of their stay at the San Marco. They get $90 to keep, so it's a little different than it might be here. So they have to want to live there, and it's a voluntary thing. So you want it in an area where folks are comfortable. And these are urban folks, they're mainly in the downtown area, so we wanted it in downtown. In the city of Duluth, we had an apartment building, San Marco, that's where we got the name, an apartment building that was abandoned and condemned, and there were squatters living in it. The city took it with eminent domain, bulldozed the site, turned it over to us, and we built the San Marco. And by the way, while we were doing it, the original project that I was talking about, the Gardner Hotel, was at the end of its lifespan in terms of tax credit projects, so we sold that building and moved those units, and so the San Marco is 30 units of housing for chronic homeless alcoholics and 40 efficiency apartments that are connected, so that when you come in the door, you can go to one side is the supportive housing, the other side is the efficiency apartments. And what's beautiful about that is, as people from this side get some sobriety and want to make improvement, they can move to the other side. And so we have this kind of natural flow, but they're physically separate buildings, but it made the whole project economically work better because we could spread the cost. It's a secure building, so people have to be let into the property, so we don't have somebody showing up with their 5 new best friends coming into the building. So there's like Carlett Manor, there's a secure entrance, and that's for both sides of the building. So it's right in the downtown area. As you can see, Duluth Philly, like San Francisco, and so there's some exercise, and there's, frankly, there's liquor stores within walking distance, which is kind of an important thing. So you don't want to put people where they have to take a cab to the liquor store. So, and I know Anishinaabe, their siting, Mike, was you cited that building right where the folks used to hang out, right?
Right, and previous to that, it was a school, it was a school building. And so again, it was in the community. I go through the questions of what key actions helped to make it happen? And it was, we had some negative thing happen. We had again, the police department works with these people on a regular basis if you don't have a solution, all right? And at some point, they get kind of dehumanized, all right? I've seen Charlie 150 times. I'm really tired of Charlie. I'm tired of Charlie picking Charlie up. And it got to a point where 2 Native American men were passed out. One had defecated on himself, the other one urinated on himself. The police, in all of their wisdom, decided they didn't want to put him in the car because it would soil their seats. They put them both in the trunk, and they closed the trunk lid, and they drove to the ER, and they opened up their trunk in the ER and asked the orderlies, "Come and get these drunk Indians out of the back of my trunk." And the joke for the Minneapolis Police Department was, how many engines does a police car have? And it was 3, 1 in the back, and 1 in the front, and 2 in the back. And that brought a cry from everybody, not just the Native community, because it was a human rights issue. And do you have to go that far to have this happen? No, you don't. There are a lot of opportunities to intervene before you get there. And all of a sudden, so we had the cry of not just the Native community, but everybody, seeing that this was a problem and identifying it as a problem. And now our best resources are the police and the ER, because they know how well it works for us. Buildings, community housing or supportive housing, these are community members. I'm going to switch over to, this is Anishinaabe-Waukahigan. And again, it's right in the city, right on Franklin Avenue. And behind Waukahigan is housing, is parents and families. And the flag in front of there, I had the manager call me up and say, "Mike, we have a number of veterans in our building that would really like a flag on the building, just because they want one." And their idea was to get a flag, a $12 flag from the hardware store and screw in the thing and put it up there. And that was, I looked at it as something different. I said, it's time to acknowledge, that we have warriors and veterans that need to be recognized. And so we actually, it cost me $200 for the rock. It cost me $600 to get the rock there. And put a plaque on it. And the plaque is for, it's recognition of all the warriors and veterans that have served to our country for our culture, our language, and our land. And we had 1,000 community members that followed us on a walk down Franklin Avenue. We had color guards from every reservation and others that came into play, because it was a recognition of the veterans that we have, not just in the building, but all over. These people are veterans, their mothers, their fathers, their grandfathers, and their children. And so that's who you're dealing with.
Does your facility is strictly Native American?
No, it's all fair housing. My facility is primarily Native American because that's who we market. There are 2 other Housing First models that don't serve Native Americans. They open to everybody, and some Native Americans choose to live there. And so it is open.
Are federal funds available to you because of the service to the Native American community, or no?
No.
It's all state funding?
Correct. As an urban Indian, we serve 38 tribes, on a given year. This last year we had 38 different tribal members that lived in our facility. And so there is no pan-Indian, there's no pan-place. Everybody gets things from different places. We do have Indian Health Service, Indian Health Board in town, and so the medical piece is a place we can send them for medical care, but it's not attached to our building at all.
I will add though, so there's a I was going to say, so there's another urban Indian project in a smaller community where I live that's closer to a reservation or where I used to live. And the tribes are actively in providing operations funding support because they want some of those units set aside for their tribal members. And it is not a fair housing issue. We've worked that out all over the country. And actually some of Mike's other buildings are being subsidized by nearby reservations so that they can house their tribal members. So that would be an option here potentially.
Mrs. Johnston and Ms. Murphy.
Do you have any registered sex offenders in your facilities?
Medical?
No,
Sex
sex
offenders.
offenders in your
Oh,
facility.
no, we don't.
I just-
That's a problem. It depends on, I guess there's certain low-level, they're classified, there's a low-level sex offense that is not reportable to the community, so,
Right.
because we don't want, I mean, it's an issue for the whole community of people that are living there. Even though, when you really look at sex offenders, I mean, some of them, they were involved with an underage girl
Right.
30 years ago, and I mean, it's not, they're not predatory sex offenders, so there's different ranges, but that is problematic because of what it brings, the reflection it has on the whole community. So if it's at a level where there's no reporting requirement to the community, no notification, then it will be considered, but that would be a very low level.
And for a lot of projects, it's just a logistical challenge because they're often using project-based Section 8 as the operating
Right.
subsidy for rent source, and so then.
I just think when
eligibility
you were saying
criteria.
downtown and where, you have so many restrictions with sex offenders.
I was taking notes at last week's session and sort of making note of things that we might ask the folks from outside. And one was, I know the municipality or some parts of the community might be thinking about ways to restrict access to alcohol. And so it just struck in my mind as this kind of carrot and stick thing. And can you speak about communities? Do you know of communities that have maybe used some other tools to shape behavior of the street population, or is that an effective way to go?
Well, I think what you have to realize with any intervention, there are consequences and unintended consequences. So I haven't really seen that. In fact, we see it in our area. We see it going the other way. We have people distilling gin and hard liquor in Canal Park at Duluth. So there seems to be that. So no, I haven't seen that specifically in terms of prohibition. I mean, again, I think you really have to think that through and.
Well, let me ask you a little follow-up question. I mean, because one of the lines of thinking was, if we're talking harm reduction, and I think one of the things the projects are trying to do is immediately move people onto regular alcohol from
That's
Listerine
right.
or
That's
from
right,
whatever.
right.
So, okay, then onto alcohol, and then as quickly as you can, moving people to lower alcohol content substances.
Yep.
And so there was some discussion that if you had a Housing First program, or you were working with a harm reduction model, would it make sense to have a beer and wine only liquor store nearby? So you could essentially use the market to kind of be a part of the shaping of your behavior?
Yeah, that might make sense. I mean, both Mike and I agree that, we simply ban non-beverage alcohol from the building because it's so toxic and so dangerous, so.
Like the powdered and
The Listerine
Listerine,
and the
oh,
Absol and all that,
okay,
or just simply ban.
Okay.
And then, the
Yeah.
rest is, you probably remember at the San Marco, we bought the residents backpacks where they could carry a 30-pack of beer to kind of encourage, because a lot of street people drink hard liquor because it's portable and easy to conceal, because you can't, be drinking openly in public with open liquor consumption. So you can do some things to encourage that, and yeah, I mean, that makes sense. I mean, we definitely want to move people to safer forms of alcohol, and there's no question that wine and beer have a less toxic effect on individuals than vodka and other hard and spirits. So, anything you could do to encourage that would be helpful. I mean, some programs, it was proposed at our program that we have a vending machine, a beer vending machine in the building for kind of inexpensive beer. And I said, that may be really a good idea, but, my agency is involved. This is never going to happen. We are never going to be selling alcohol.
I talked to
I'm
Kenny
sorry.
about that,
That's a bridge too far.
I
That
talked to
even
Kenny
goes
about
up. No.
Well, I understand that Canada actually dispenses
That's
the
right.
alcohol for
That's
the
true.
residents in a way to really quantify a reduction in use,
And
because
it's been
otherwise
very
it's kind of
effective.
verbal.
That's been very effective.
Yeah.
I appreciate all the comment. very grateful for you being here. We were all excited about your presentation. I wish we could have given you more time. We have another meeting starting at 12 o'clock, so I have to bring this one to a conclusion. If you drive a blue Expedition with license plate FNX 932, you need to move your vehicle after this meeting if you're not otherwise leaving. It's parked somewhere where it shouldn't be.
And they may move it for you.
And they may move it for you. Appreciate it. I'm sorry we couldn't take any other questions, but thank you all for coming. Thank you very much.
Thanks, Bill.
Here, I'll give it to
I didn't think about
Oh, I thought they email and I'll send it to you. Shoot me an
Josh, he doesn't
That means that,
Ours?
Yes, I'm excited. You should tell us.
Grab one of the seats.
Hi, folks. Time has stopped, essentially. We're going to get started. There's two presentations. Some of them are similar, but there's going to be a distinct break. There may be a break midway through this work session. This one's set for 2 hours. So if it looks like we're getting spooled up or in a way that we do need to step back from the topic just for a minute to breathe, we'll do that. As those that have been to my committee meetings before, they're typically a little bit unstructured. I'm going to change that up today in terms of the flexibility and viability. It's a larger work session than works with the model of informality. So the idea that we'll sort of put a distinct presentation on the floor, most likely from the mayor to start. Try to hold your questions. If it's something that you just got to have input to, then let's really wave me down. If not, I'll start a list on those, and there'll be a time that I'll absolutely stop, and we'll be sure questions can be entertained throughout. I don't anticipate holding questions throughout the entire 2-hour work session for asking later. It's entirely possible, too, that we'll ask for a continuation of this work session or a follow-up opportunity to bring more information back to the Assembly on the 27th of this month. So the plan is right now to entertain another continuation or follow-up as we hear things and we don't have immediate answers today. So go ahead, Mr. Flynn.
I just received the report. It says confidential and sensitive information. Do we want these returned at the end of the meeting?
I would say probably not. I'll ask that question as well. I think it was the idea that the information didn't get out before today would be some of the idea.
It was in draft form, and that's on there, and when we removed the draft status, that didn't come out, so.
So I don't, there's no secrets in public work at this level. No offense to the public, if there are team members that need to intersperse, we have nobody calling in, I don't think. Is Mr. Honeman calling in? there's nobody calling in, but be sensitive if somebody does, that's the microphone for that, so as you do that. And unfortunately, in today's committee meeting, likely won't take a lot of input from the public. You're certainly welcome to reach us afterwards independently at a break or through email, but I want to keep it a little bit on task, so the idea that the interface with the public occur isn't to be offensive, it's just a matter of procedural. So I leave that to taking attendance first. Kate, would you like to start? Are we on the record now, Madam Clerk?
I believe so.
Okay.
But the deputy did that, and I'll just double check.
Just to check, we'll be sure with that, and just your name and your department would be helpful.
My name is Kate Nyard. I'm the CFO and a member of the audit committee.
Matt Johnson, SAP. Patrick Flick.
Ernie Hall.
Jennifer Johnston?
Bill Evans.
Amy Dembowski.
Pete Peterson.
Bill Starr?
Ellie Gray Jackson.
Big training.
Dan Sullivan?
Norma Johnson, SAP.
Tom Novacell, SAP.
Great.
Mr. Chair, I have a quick question.
Okay.
Is this an audit committee meeting of the whole?
It is an audit
So we have
committee.
other audit committee members sitting in the audience,
Sure.
just for the record.
Okay. Thank you for that. Mr. Raskins?
Peter Raskins, Internal Audit. Mike Chadwick, Internal Audit.
And George McKinnis will be here perhaps a little bit later. I think we're good to go, Mayor.
Thank you. And just for the body's edification, we do have other members of our system integrator team from Peloton here. We've also got key staff members who've been working on the project, and as needed, we may call upon them to answer questions, at which time they'll identify themselves.
Absolutely, just so if they come up to the speaking area, if we have somebody who calls in. Thank you.
Well, thank you for the opportunity, Mr. Chairman. We, as the body is aware, and everybody in this room is aware, because they've been working so very hard for the last number of years on the implementation of a new enterprise resource planning software system, which is where ERP comes from. And I still have people ask me all the time, what does ERP mean? And I always have to refer back to my notes to remember. Because, unless you're in this industry and work with it every day, it's not something that rolls off the tongue. So SAP is an enterprise resource planning software system. It has extensive capacity for public sector work processing, analytics, reporting, and benchmarking. With SAP installed, the municipality will have the financial and human resource tools necessary to drive government efficiency into each business activity of the city. Now, the reason we're here, of course, and a lot of you remember, some of you served on the assembly back in the late 90s when PeopleSoft was implemented, or partly implemented as the case may be. We're currently using PeopleSoft version 7.5 in this ERP software application in support of financial management, purchasing, human resource management, and payroll. It was installed in January of 1999. However, PeopleSoft was never completely integrated, leading to many workarounds to accomplish the necessary tasks. Additionally, the MOA failed to install ongoing upgrades for PeopleSoft. 7.5 maintenance was ended in 2003. This represents a major risk for the municipality and was not sustainable over the long term, which is why we went out seeking a new software system. The budget on the project to date has been a little bit, I guess, misidentified. The amount that we've actually spent on outside work on the software system is $22.5 million that has been expended and encumbered for the external contracts, data, and implementation. We've heard the figure $35 million. We actually calculate, unlike many cities where software is implemented, our internal staff time. And quite frankly, that's not really additional cost to the taxpayers. These people are on payroll anyway. It's like, for example, if we asked PR to do a reorganization, we wouldn't say that reorganization cost the taxpayers X number of dollars. That's part of the job function of people in that department. That can be applied to virtually any department when a special project comes along. So we're at $22.5 million to date, Mr. Chairman. Additionally, of course, as I mentioned, a lot of staff time involved. And one of the things that's apparent to us now is that the initial projections on the SAP implementation were very much underestimated. This is partly due to our own internal fault, but also part of the firm that we first hired for system integration. I think we probably got some underestimation of what their work was going to cost and as far as the complexities of our particular system to implement. It's difficult right now for us to predict a final budget, but one of the reasons we're working with SAP and doing the process that we're doing today is that so we can develop a full work plan going forward, provide a foundation from which we can set a reasonable budget going forward. Once we have that carefully constructed work plan, we'll put forward a budget to the Assembly to consider for full implementation. Current status, the SAP quality assessment revealed many positive aspects regarding the status of the project. That's the good news. There's a lot of good work that's been done. And while there are recommendations for improvement, there is need to recognize the good work, particularly from our internal staff, people who have worked so incredibly hard over the last number of years, and you never tell them thank you enough for that hard work. Many of the financial modules of the project should be particularly acknowledged as having met significant milestones. After a material false start with system integrator Black & Veatch, the SAP system conversion has continued to hit barriers to a timely completion. To get the project back on track, we engaged SAP to conduct a comprehensive assessment. That assessment has now been completed, and I'll turn the forum over to Norma to talk about their process and what their observations and conclusions were.
Okay, we have one question that was communicated prior to starting, if you don't mind taking a few questions, Mayor.
No problem. Go ahead.
Thank you, Mr. Chairman. Thank you, Mr. Mayor, for your presentation and your history. I really appreciate that. And you talked about the fact that the project cost is $22.5 million to date, but that doesn't include the labor. What is the amount of labor for the project?
Well, that's all the cost of the consultants, all the people external of the city itself, for the project to date.
No, I appreciate your
You mean
comment.
internal labor?
During our presentation, we've always seen a number, and I think the latest number with the last appropriation was about $34 million. But my point is, what's the additional cost? I'm just taking some really good notes here. Not the 22.5 that you already mentioned, but the additional cost.
Yeah, just the difference between those two numbers. I mean,
Okay, so 34.6 million is correct.
Yeah, if you subtract the 22.5 from that, then you'll have the internal cost.
Thank you, Mr. Mayor. Thank you, Mr. Chairman.
Anybody else at this juncture? Okay. And somebody else can do the speaking in there, or are you going to go through the slides?
Norma here is with SAP, and she is the lead on this project, and will run us through their results.
Great, thank you.
Thank you, Mr. Mayor. Thank you, Mr. Chairman, also for this opportunity to speak with the Assembly. We'll go through the PowerPoint, and I think all of the Assembly also has a copy of it, so you can take notes and we can ask questions. And if we go to the agenda, I would like to first start with the background, so we all have the same level of understanding of how we got here, and typically what we do from a quality assessment, and then get into some of the results and the information that I'm sure you are all anxious to hear about, and then we can take some questions. So we'll go through the background, we'll talk about quality assurance, or we'll also call it QA services. What does that mean? We'll talk about the team that we brought on site, the scope and the methodology that we use, and then we'll talk about the approach and the timeline, and then we'll get into the actual results and findings. So a little bit about quality assurance assessments. It's really, I'll first say that it is a globally defined methodology that SAP has. So it's not something that we just bring in and try to ask a few questions. It has a definite methodology and a process and an outcome that we use from a global perspective. It is here to help customers, to help them understand what they've designed, and if they've gotten the maximum potential out of what they've designed, and also to minimize the risk from a point in time and looking forward. So it covers multiple dimensions of a project and the quality of the project. This can be completed, these type of assessments can be completed basically any time during your implementation. So you don't have to wait till you think, oh, I'm in trouble, or I'm not quite sure what to do. It's really an insurance policy, if you want to look at it that way, to do it before you even get in trouble, right? So you can identify risk early and mitigate that risk before they become larger risks. So we tried to do that throughout the entire project, and it's an assessment, as I said, with global methodology around it. It's performed from an independent and objective point of view. So we have a separate team that manages these type of implementations or type of engagements, and they're independent from the other organizations. A little bit about the background, so if you say, okay, well, how many of these have you done? So I thought you'd be interested that from a North America perspective, this isn't globally, but from a North America perspective, we have completed approximately 500 of various types of quality assurance assessments. Out of that 500, approximately 25% of those are from a state, local, and utilities organizations and communities.
On this point, Ms. Johnston has a question.
Just the Q&A, this is similar to the 2012 Q&A. Would you?
That's a good question. In 2012, we were here in 2012, and we were asked to come in and do an assessment that was much shorter. So if you look at it, it was around 472 hours that we performed an assessment. That was approximately 3 days or a week worth of work. And it was not as deep. So the scope was not the same. We didn't look at some of the exact same things. We were asked not to look at some things or to concentrate in certain areas. So the scope was different, wasn't as deep, and it was much shorter assessment. So I said 472 hours compared to this assessment that we just completed in 2015, which was approximately 2,500 hours. So you can see that that was quite a bit larger and in-depth.
Go ahead, Ms. Johnson.
I just call, on that 2,500 hours, I mean, some of this is base point where you're in and you're looking into the system and you're on site. And so the 2012 on the on-site, and then did you write it off-site?
I'm trying to think of 2012, we would have started the report on site and had some initial observations while we were on site, and then the final report would have been probably completed off site at that point.
And was this one, the 2,500, all on site?
It was a combination of both on site and off site.
Go ahead.
Also, what I'd like to point out on this slide, there are other types of quality assurance assessments that we do perform. We were asked to perform the solution, which is your design of the system. We also do program and project management assessments. The Assembly decided to have an independent view of that, so you have someone else, and I know you'll be talking with that gentleman later. So we did not look at the project and project governance and project management side of it. We concentrated on the solution side.
I have a question in regards to that as it affects Peloton. Can you explain, when you mentioned the lack of project management oversight or that element missing, what is the relationship between your review and the Peloton group?
I'm not sure if
I don't need to be ignorant, but did you audit the Peloton's performance as part of that comment that you just made?
No.
Okay.
What we do is we assess the current state of your design and your documents and your system.
Okay.
And it's at that point in time that we look at it.
Thank you. Well, I just haven't read some of the stuff deeper in to know where we're going with the scope. Thank you.
Great question. Great question. Just go back one more slide, please. You're great. We also look from a technology. We also have a team that can come in and look from a deep technology perspective, and also organizational change management type of things. I just want to make sure that all of these other things that you can do there. Okay. Thank you. So what are the goals of a design review or a design solution assessment? It's really to look at your current your current solution and whether your system is currently on track to meet your business requirements. And then to evaluate that design, and if that design is going to be flexible enough for you to move forward. Or are you painting yourself into a box, maybe with too much customization, or maybe going down a path that you shouldn't do? And let's bring it back, get into some leading practices that we know are maintainable and sustainable going forward. We also look to ensure that you're within the SAP standards and that you're within their practices. We also look to see if there's any risk that you should take action upon now. So if there's a high risk, a medium risk, or a low risk, and we identify those for you so you can prioritize and decide what are the key risks that we need to address. And we bring in a complete team, and some of you may have seen that team or been around when you saw the team. We brought in approximately, it was, I don't know, between 15 and 20 knowledgeable SAP consultants. So these are SAP knowledgeable, experienced consultants that come on site to do the design review. Questions on that?
And the consultants, are they contract consultants, or are they SAP employees?
It's a combination. It depends on the engagement where we are. It's a combination of that. And in your particular situation, it was, we had 3 contractors that we brought with us.
Just 3 people?
Three people out of the 15 to 20 people that we had. I thought you might be interested in a little bit of background. I talked about where, from an SAP perspective, we have completed approximately 500 different assessments in various customers, various types of line of business, and also in local, state, and utilities. And out of all of those approximately 500, as we assess them and we assign risk factors to the project or the implementation, we then look at if it's a high risk or low risk or medium risk. And out of that 500, we have found that there are common themes that reoccur in these projects or implementations that are rated high risk or low or medium risk. And I thought you would be interested in seeing some of the output of that statistics out of that 500. The top 5. So if you look at on the right-hand side, from a resource management perspective, we continually see that there's unclear roles and responsibilities, insufficient resources, so resources are scarce, and leadership and soft skills, where maybe the team members need additional skills to understand what they're embarking upon when they do this type of implementation.
Mr. Flynn has a clarifying question on that.
I'll wait till she's done with this slide.
Okay.
Then I have a question.
Perfect.
So 80%, so that's the number one common theme that we see occurring is in the resource management side. And right behind that, at 79% of these projects or implementations, we see schedule issues, so the project schedule. So either an incomplete project schedule, or the schedule's not being maintained, or it's not realistic. So you don't know, if you're not keeping track of how much work effort it will take to complete a task, you really don't know how many people you need to do that and how long it will take. So that's a reoccurring theme, the second top one that we see. The third one at 67% is testing management. So testing is not focused on what's the business scenario and what's the business outcome. A lot of times it's more about the technical side of it, but we really need to focus on the business side. Are we getting the outcomes that we expected? And then from a testing perspective, do we have enough resources and the right skills and the right knowledge that when you do test, do you understand what you see when you test? So if you're testing payroll, if someone is looking at the results of that test, do they understand what they're looking at when they have deductions and they have maybe automatic deductions going out to their bank or something like that? So you need people with that knowledge to understand the results of the test. And then also a lack of parallel testing, particularly in a payroll environment. If you're going to print checks, you look to make sure that you do multiple parallel testing so that what I was printing on a check is what the outcome is on the new system. And if there's a difference, then there's probably some known differences, maybe the way you calculated tax before and the way it calculates now. Or if there's some unknown differences, then you need to find those out. So always, it seems like when projects get into a time crunch, testing is one of the things that they start to shorten. So testing comes up often. And then at 62% is the integration management. So effective change control, an effective project and phase closure. And I'll talk about that a little bit more, is knowing what you've completed before you move on to the next step in the project. And does everybody agree we're on the same page before we move on? Also, the overall solution integration is everything fitting together like it should be. And then data, and managing that data. So is your financial data accurate? Is your payroll data accurate? People find that at the very last minute that their old legacy data is probably not as clean as it should be. And they don't give enough time or energy or thought to how do I clean and how do I cleanse that data. And then the fifth one is scope management. People understanding what it is that we're trying to accomplish with the implementation staying within those boundaries, because it's nice when the user starts seeing the SAP system, they see all these other things that it can do. And it's very easy to go out and say, oh, I know I need that, let's put that in here, no, I need that. Not really, I mean, they're very honest about it, but they don't know the impact that they're making on the system and how much time it might take to do that. So it's important for the project management to control that scope and understand. And if we do in fact need it, then let's go through a formal process that we sign off and we all agree that it has this impact on the project. And then informal deliverables and review and acceptance of those deliverables. So I would like for you to remember this wheel. I'm going to refer back to it a little bit later on, specifically to the municipality.
Mr. Flynn?
And you touched on a little bit of it in your conversation, but I mean, given the frequency with which you have these findings, what steps do you take as an organization to address them on the front end? Prior to part of your bid, part of your implementation process, what would you do?
That's really a great question. We approach it in a couple different ways, depending on if it's an SAP professional services-led implementation. Then what we do is we take a lot of this information and we circle it back internally to SAP. And we say, well, we know we've always seen a lot of schedule issues, project schedule issues. What tools can we develop to help that project manager to ensure that he has the right tools or she has the right tools? So we take that information internally back. What we also do with it from, if it's a partner-led type of implementation, such as Peloton, we like to partner with our partners and say, here's the type of things that we've been seeing in partner projects. These are reoccurring no matter what. And we would like you to know about them so you can take that back into your organization also and improve upon those areas. Does that answer your question? Sort of.
Yeah, I don't know if it was real specific to the municipalities' challenges at the moment, but maybe we can get into that a little later, Patrick.
Yeah, I guess at some point I'd like to hear Lance's perspective on that. We can do that later.
Fair enough. Thank you.
Thank you. So talk a little bit about the scope of the quality assurance assessment for the municipalities specifically. We were really hired and commissioned to look at and assess the alignment of the municipality's functional solution, so what you've currently designed, and compare that to your business requirements, what your organizations say you need to run your business, and then to assess that and look at it and compare it to the SAP standards and leading practices that we had in the SAP system. So that was sort of the objective and the mission that we had. And as a result of that objective and mission, what we really looked at was what we call a solution design assessment. So where does your system stand today, this point in time? Where does your data migration stand as far as your strategy for that? And where does your testing processes and strategy stand? And then also we were asked to look specifically at your project schedule and assess that. We didn't go any deeper into the program or project management side of it, but we did assess the project schedule. And as we talked earlier, which was a question, is compare that to 2012 to 2015, there was approximately a 2,500 hour effort on this particular assessment, looking at these particular areas.
I have a question. Mr. Raskins, I'm not sure if you're the person to answer it or not. I lost touch after we were originally approached for the appropriation on your services. Did you manage the RFP for this particular?
This one. Oh, no, this one, no. This is, the CFO did.
Okay, so I guess that's, my question is, these 5 or 4 priority points of that were communicated to you by the administration, or how else did you determine where you need to go with the scope of the look-see on this?
So it was talking with the municipality's project team and their leadership, and asking where are your pain points, where do you think you have issues, and coming up where we think is the best areas to spend your money.
Yeah, the funding element in here from a guy that's focused on numbers, the financial conversation, I was hoping to have a little bit of value conversation as to are we getting our money's worth, are we cost overrunning, are we that? So if that didn't make the scope of work, we'll have to approach that a different way. Thank you. I have another question too. Did you have anything more to add to my comment, Mr. Mayor?
No, just Norm informed me that the taping or recording of their information requires a clearance from their legal team, which I don't think they...
Well, it's on record. I mean, it's being taped right now.
You can certainly have that, but we do business in the public, so I'm not uncomfortable with that conversation because we let your contract in public and you're delivering what I feel are deliverables based on that. That's partly why I asked the question, was the compliance with the deliverables and the expectation of those deliverables. I'm not certain is very clear with this body, certainly not with the audit committee in terms of what you were absolutely asked to task on that. So it's not an item to try to create controversy here. It's a matter of at the end of the day, are we getting what we paid you first to do? And then secondly, if there's another, come back and say, hey, wait a minute, we need a little bit more information. I certainly don't want to ask questions outside your scope of evaluation. But that, so if your confidentiality concerns are that, this is an open business when you're doing business with the government, so.
If there is a question that was outside of our contract,
Yes.
what we were assessed to do, then I will say that
Absolutely.
I can't comment on that. We didn't
Yeah,
assess
and I didn't initially ask the question to you. I asked it to our auditor who had some involvement on another contract associated with a similar topic. So the reason I brought it up wasn't to put anybody in a box on that. It was just a matter of as we get to where we feel comfortable with your product being delivered to us for that value. My question on the financials wasn't so much are we getting our money's worth out of you, but are we being fiscally prudent in terms of your observations with other experience levels? Are we floundering in finances and throwing money at things? Would be a nice answer for me to hear from somebody that knows.
We didn't assess that.
You did not.
We didn't assess
I get that.
your spend.
Ms. Gray Jackson has a question.
Thank you, Mr. Chairman. I really appreciate your comment in terms of your interest with numbers and talking about finances, because I have the same interest, being the chair of the Assembly's Budget and Finance Committee. So 25 hours of effort were spent.
2,500.
I'm sorry, 2,500 hours of effort were spent. What's your hourly rate?
I don't have that in front of me, so I
Can
didn't.
somebody tell me what the hourly rate?
The hourly rate was $306 an hour.
Thank you, I appreciate that. Thank you, Mr. Chairman.
Go ahead, I think we're ready to.
And I'll put an editorial comment and, not putting them on the spot. I think the reason we called SAP in is because we did feel like we were at a point where our money was not being as well spent as it could have been, and that we were probably at a point where we needed to step back and not just move forward without knowing exactly how that money would be targeted effectively. I think we came to a point where we questioned whether we were spending effectively.
Yeah, and I think we take an oath of fiscal responsibility on this side of the body, and I'm glad to see that you're actually here in the room. So it's not to launch into a totally divergent conversation. It's to also recognize that there's probably going to be a continuing investment, and we'll have to have that. But I don't want this whole meeting to diverge that way yet. Certainly the findings and the action plan and some of the things there will come with a price tag. And then another conversation, I primed the meeting on the 27th, maybe that's when data is exchanged in that format. But certainly it's not to put a grenade here in the conversation, it's really just to say we'll have outside questions. So your answer that's not something that we addressed it's not offensive.
Okay.
Thank you.
Thank you, Mr. Chair. Any other questions on this slide before we move forward? Okay. To look at it another way as far as what we focused on for the municipality for this assessment, and I think you may have seen this drawing. I think the CFO may have had something similar at one point. But we wanted to just sort of give you a picture of there's more things around your implementation than what we assessed. If you look they're supposed to be green boxes, but on the screen you can see the sort of gray, bluish boxes. Those are the areas that we perform the assessment. So we looked at data migration, so what type of data are you bringing or have you decided to bring over from PeopleSoft? We assess your blueprint. So what's the foundation? If you were building a house, what does that blueprint look like? Where do you put the walls? Where do you put the electrical outlets? Where do you put the light switches? Where do you put the furnace? That's your blueprint for your implementation. We look at that. We look at the configuration. So what did you flip on and flip off the switches inside the system to make it run the way you need it to run for your business processes, based on your business processes and what you documented. And then we compare that to the core SAP software. So not to bore you with the areas and all this terminology that people get confused on with SAP, but like the general ledger, accounts payable, accounts receivable, funds management, payroll, HCM. Those are the type of areas that we focused on and we were asked to focus on during the assessment.
What's AA in that definition?
Assets management.
Ms. Johnston?
Sorry, and your custom objects, are those like our union agreements, or are those?
What that is if somewhere along in the project you decided that the SAP software was not going to meet your business requirement as it is, that you may have written a custom program to enhance that. And we would have looked at that and said, instead of writing that custom program, look at the software this way and do it this way. So you can stay standard inside SAP instead of writing these custom objects.
So these can be business-made decisions?
Yes. SAP can handle it, but based on what your needs were, you felt like you needed to do something different. So we looked at that and made recommendations. Could we bring you back into a standard SAP format so it's more sustainable and for the future?
Assemblyman Trainee has a question.
Question for you, ma'am. When I look at your chart up there, I see interface is 66. So you didn't look into things like Kronos, because that's an interface system coming in to SAP during this time?
We didn't look at Kronos itself. We did look at how it impacts your system.
Not Kronos itself.
Not Kronos itself, no.
One other thing, Kate, can you give me the latest version, if you will, offline of Kronos we're using? Because I'm finding when I look across the country, there's significant problems with Kronos. And so I want to know what version we're using. Thank you, ma'am.
Ms. Dombrowski?
Very quick question, I'm sure you'll get into this later, but when we're not specifically talking about Kronos, what about the interface of, this like Telestaff, Teledriver, all these different interfaces that we're finding issues with? Is that something that you guys actually looked at? I'm assuming it is.
We didn't look at the effectiveness or how the interfaces were built.
Did you look at how they interface with SAP? So we have Kronos, we have SAP. In between, we have Telestaff. Let's take that one for example. We know there's issues. Those two weren't talking to each other. We were talking about the bridge to build to get one to the other. Did you look at that bridge?
We looked at whatever that bridge would be, what impact it would have on SAP.
Okay, great. I'll wait for that.
We didn't look at that, but we looked at the impact to SAP.
Okay, I'll wait for
Or
that.
to your implementation.
Okay, thank you.
And just to follow up on that, you'll see one of our recommendations on the go-forward plan addresses that specifically.
I figured it would be there. I just wanted to clarify and make sure.
Is that blending going to be, it appears that you're trying to keep it separated in the human capital management side, and then you've got the logistics and financial side of things. Where does that conversation Ms. Dombrowski raised with the timekeeping systems and that, what side is that on, or is it throughout?
The timekeeping would be over in our human capital management side.
Because Telestaff is a scheduling program different than perhaps a payroll function. So, okay, just so I'm clear as to where you're headed. Thank you.
We also looked at the testing as far as your testing strategy, where you are in the testing cycle, what's been completed, what hasn't. We also, down at the bottom, again, just to restate that we didn't look at program project management, but we did look at the scheduling side. Another view is to look at the landscape at the municipality for your SAP solution. And if you look at the top, when we perform the assessment, we really start with the business functional view. So from a finance and logistics perspective, and also the human resource, human capital, and how that is organized across your functional organizations, and then what business transactions and what business processes do you have to support those areas in your organization. So we look at it from an organizational perspective. Then we understand that based on your documentation and based on what you've done to date, current state in the system, and we take that and compare that then to the SAP software, and how that impacts the software and what you have configured in the software to support those business transactions. And as you'll see down at the green box that goes across finance and logistics and human capital, that is all integrated together. So it's not a separation, but that is information that is feeding each other real time. And so how does that feed together? There's some basic master data that supports all of those transactions, and there's some enterprise structure that supports that. And then you have the individual areas that you are implementing. And we just tried to depict these by boxes. These are all integrated. It's just a box, a picture to show you some of the areas, you know, how broad this is. And below that, below each of these boxes are many subtopics too. So it's very broad and very deep.
I have a question in clarity. There's been the use of the word FILO around here fairly regularly now. Do you define the FILO, and if you do, what do you call that?
So I am using SAP terminology, which is finance and logistics,
Okay.
and HCM, which is human capital management. Some people shorten that from financial and logistics to FILO. That is just a speculation on my part, and I shouldn't even speculate, but I think it's just a shortened terminology of finance and logistics.
Okay, and I'm trying to
Someone
keep
else
up.
in the
I got
room.
confused by what you had just said with the blended conversation, but there is two distinct functions between FILO and HCM portion of it. Is that still true?
There is distinct functions in finance. So in finance,
Yeah.
you have accounts payable, accounts receivable, cash management, funds management, all the financial and controlling type of information.
Mhm.
Logistics is you have supplier resource management, so where you're
Right.
buying and purchasing and managing the inventory. All of that is integrated. So when you're buying and purchasing and using inventory, it's integrated into the financial side.
I'm just confused by this slide then, without trying to be ignorant, because hopefully I'm not always,
No
but
problem.
the brown boxes underneath that, then, is there any definition on which ones are FILO related and which ones are HCM related? Because ultimately, there's an integration.
Yeah.
Say again?
So,
In the top two.
and organizational management, personnel administration, benefits, payroll, time, those are basically your core foundation for HCM. And then you have the materials management, suppliers management, from a logistics perspective. And then you have FI, which is financial, COs, controlling, general ledger, accounts payable, accounts receivable. All of those are from the financial perspective.
Okay.
All of them talking to each other.
I get that, and it's not dissimilar to what I had understanding before that. Prior to this conversation, when we evaluated the need to do this analysis, it was around the conversation that perhaps FILO sections or segments were perhaps ready to go live or were farther along down the path, and so I'm looking for where you analyze the stumbling blocks, and so by keeping those two separate for me, it certainly helps me, as I'm certain we'll get into some recommendations if that's the case. But you hadn't used the word FILO up to date. I want to make sure we had the same conversation as to what that
It's
was.
just not an SAP term.
Understand. Thank you.
And just to elaborate a little bit, it may not be in this presentation, but in your big book, the separate go live is not recommended by this.
Yeah, and I didn't mean to put words. It was some conversation that we had prior to analyze where we were at, so I certainly have an open slate. I didn't mean to put that as an opinion out there. It's not. Thank you.
Great questions, Mr. Chairman. And as Mr. Mayor had pointed out, and I probably should have pointed out earlier, you all, each of you do have the full findings, big binder of the book.
We've all read it.
You've all read it. So there will be a quiz at the end of the day.
We need spoon feeding, keep spoon feeding.
You know, and on this chart, it is for future,
For you.
color-coded ones that are HCN.
SAP confidential and sensitive information. Does that mean you can't use
You know, we covered that earlier at the meeting, you might have been back there.
And what'd they say?
Free to go. This was on an earlier
So I
draft.
see that, I want to make sure the public.
They can get it. Go ahead.
Okay, thank you, Mr. Chairman.
Yes.
Next slide. So just another view of the process that you go through in an implementation. Sort of still setting the foundation of an implementation. There's certain, what we call phases. If you look at the gold top chevrons, phases that you go through. So you have a project preparation phase, a blueprint phase, realization, final preparation, go live, and then of course run or operate phase. Between each of those phases, you'll see the little green triangles, not triangles, what am I calling? Stars. Diamonds. Diamonds. Thank you. I couldn't think of the word. Diamonds. I love diamonds. So you'll see the diamonds in between each of the phases. Those diamonds represent quality gates. So when you're done, when you think you're finished with project prep, there's a quality gate that you need to go through to say, am I ready to move on to blueprint, where you're now developing the blueprint as if you were building your house. And that quality gate is in between each of these phases that we talk about. And there's specific documentation and specific processes that need to be completed before you move on. Some can be overlapping. It depends. It needs to be discussed. Is this something that's not completed? Can I live with that and it will be done a week from now or 2 weeks from now? And is that acceptable? That's what your program and project management needs to understand, and your project team needs to understand, can we move on farther? So if you look at project prep, you start with a project plan and what scope from a high level are we implementing? And then once you have that established and you go through that quality gate and everybody agrees that we're far enough along, the key core things are complete and documented, we can move now on to the blueprint where we're actually going to start writing down and documenting what we want our solution to look like to support our transaction. And there is a lot of documents, a lot of documentation that goes on during that time. That is your foundation. This is what you will use to move forward throughout the life cycle of your implementation. And you might be scratching your head thinking, well, it's just documentation. It's important documentation. It's what you need to go forward with. It's what you will need to help train new people as they come on board. Or if whatever you need to do going forward to upgrade your system, it's important to know what you established in this implementation. Your documentation sets that for you. How are we going to structure our organization? What are the business processes? What are the interfaces that we need? Then once you feel like you have all of that, then you do a quality gate and say, we're 95% and 99% ready, let's move on, 100% ready, let's move on. And you then go through realization, you're developing your business process master list, you're developing your scope, your baseline scope, and honestly, this screen got a little big. All of this should have been moved over past this go live date. But you're also looking at, during final prep and in realization, what procedures do we need? What test cases do we want to run? So how do we want to test our payroll? How do we want to test our financial close for month end and for year end, etc. All of that needs to be accomplished and then reviewed before you move on to the next phase. Then as you get closer to go live, what's your testing plan? What's your training plan? And when are we going to accomplish that training plan? And then, of course, then are we ready? Another quality gate, are we ready to go live? And all thumbs up, and people are ready to go live. That is all important to continue with the progression of your implementation, and then when your system is live. So it can be traceable, it can be verifiable, and then you can maintain it, sustain it, and grow with it, and it can grow with you as you grow, the municipality.
I'm going to stop you right here for perhaps a selfish purpose, but also a productive one, I think, is there's, Mr. Mayor, there's oftentimes a perception to kind of go back and quarterback or do the after-game review on where failures had occurred, and so I'd really like to spend just a few minutes trying to get that behind us. And my observations are several. Perhaps Mr. Flynn was going here earlier with his question. Mr. Mayor, does this look familiar to how we approached this project from the very beginning in terms of what we felt we were needing to do, steps along the way, knowing that we had some failures? You mentioned the Black and Beach conversation, some of that. This shouldn't be wildly different than what we were going to use for an implementation strategy to get to pass go live to the operating system. Is that, this isn't a surprise to you then?
Well, no, I think what happens is that within each of these categories, it's how complete is the work done. It's not that the overall project management design would be significantly different, but you have to perform the tasks to a satisfactory level of completion before moving on. I think that's what we found, particularly with Black and Beach, was that some of those were not satisfactorily completed, and yet they did move on. So,
well, I don't want to dwell in the obvious where the failures or breakdowns occurred, but I don't like to repeat them as we come forward. So, sort of that honest conversation of where we didn't invest the capital with personnel, the dedication of that. I've seen things personally that I like, and it's not to pontificate, it's just I want to move past any criticisms about where we failed, and it's going to be woefully failure, so that we can dredge up any conversation in here that the continuation of the SAP implementation is somewhere where this leadership body doesn't want to go. I want to get past that today, and so it's not a forever hold your peace conversation, but we try to have meetings in public. But I preferably not read about it in the paper that somebody's dissatisfied with the SAP product or more critical of where we're at. I think we've all have a liberty, and I'll give Ms. Gray Jackson a plug here. She was telling us to watch and to look and to see, and I was ignorant to it. I trusted perhaps when I shouldn't have, and I commend you for having that time and time again drum beating. But I also want to get past that, and so we're hopefully moving towards the solutions. And it's not to be flippant. A lot of this is management 300 level college course stuff. So we've got to get real here pretty quick and get this thing done. So take us there. So you've showed us how you analyze and all that stuff, but we need to get to where we're going. So is there critical statements of the administration, and I'll put on the record of Ms. Mahoney prior? Let's get it out there now. Mr. Flynn, you started to go there earlier. Do you want to go back there, or maybe I put words in your mouth, but let's have that conversation for a few minutes and get the uncomfortableness out of the way, because I don't want to be critical. I want to know that we're going the right place.
Mr. Starr, I'm not yet ready to verbalize my thoughts.
Okay, thanks for that.
And Mr. Starr, I mean, if we didn't think mistakes were made, we wouldn't have had SAP here to help us get back on track. So
we have opinions about those mistakes, Mr. Mayor, and from this body. You guys have internalized them, you've dealt with them, and you're moving on. I want to make sure we're ready to move on too. That's all. So 5 minutes if you can do it. We're not here to beat anybody up, but I want to hear it so we don't hear it later. Mr. Trainee, and then Ms. Dembowski.
Just a question from the administration, maybe the mayor or Kate. I've heard a rumor that since November the 1st, there's been no integration going on. That in effect, SAP has been stopped, dead track. Is there any truth to that? Have we been working on bringing the system on? I'm just hearing rumors since November the 1st, nothing's been done to bring this thing forward.
Through the chair, Mr. Trainee, I'm not sure if there was a drop-dead deadline on November 1st. I can tell you that we did stop all progress in December, absolutely, because we were preparing for the SAP audit, and we spent the entire month with all the team going through the workflows and finalizing and updating the documentation that we did have in preparing for the audit. I imagine that the work did slow down in November, and I think Peloton could give you an exact date when we did slow down the project, but we were encountering challenges on how the data conversion was going to be done on projects and grants. And I understand that that was a significant item which did slow the conversion. So Peloton can probably
We're
tell
not
you
in
exactly.
February, so my question is, did it start back up and on what date?
Mr. Chairman, it hasn't started up again yet. We just finished the SAP QA, and the staff have been head down in the audit, developing the response plan.
Thank you, ma'am.
And they may come over in a scheduling suggestion later, I hope. But Ms. Dombrowski?
Thank you, Mr. Chair.
I know.
I think, with all due respect, I understand the hope to essentially control comments that are critical of this project. I don't think it's going to happen. But nonetheless, I find this first hour of our 2-hour presentation has been helpful. A lot of us have read the RFP. We understand how you guys were going to proceed for the most part. And I think what we're all waiting for is we want to know what the need, where we are. So, you know, I know there will be lots of questions, so I just respectfully ask that we speed up this process so we can get to the meat of what your findings were. Thanks.
We are like
There, I know. I keep reading ahead.
Oh, you're reading, okay. So
I'm trying.
And it's not to control Ms. Dombrowski. I feel like it's a place where I don't want to have to go back to as this body. Personally, you can certainly do that, or you have suggestions.
I didn't say that. I just want to get to the...
Direct to the administration, and I do too. But I feel like, it's where we've come from, and I think that my feeling is, where are we going? What are your suggestions on where do we go? Do you need a break, or are you ready to tell us?
I'm ready to go.
Let's go.
So, you hit enter. I'm not going to spend a lot of time, but this is the process that we went through to get to where we are today. You'll see the circle is to present the findings and where we are today. So a lot that we did there. We won't dwell on that. Then if we move forward, just to give you an idea of the type of team that we brought on site and their experience that we brought on site. I'm not going to read all of that, but you can see that there's a lot of 5, 9, 10, 15 years of experience, just to give you some idea of the type of team we brought on site. And so what you've been waiting for, right, is where do we stand? What does this look like? To explain the slide a little bit to you, if you'll look at the top right-hand corner, if it's a green circle with a check mark in it, that means that there was low risk, which means that it may produce a minor impact to the implementation, or to the ongoing operation, but it's not a major thing that you have to worry about. You might want to fix it because it could help you later on, but it's not something to dwell on. The yellow triangle with the little car going sideways is a medium risk, which means it may produce a negative outcome on the implementation or the ongoing operation, and it's something that we need to address. The red triangle is a high risk, so it's a significant risk, it's a significant likelihood that you're going to have trouble or a negative impact on your implementation or going forward in your project and in your business. So it's a critical issue.
And just to put this all in perspective, because as we get on this racetrack of low, medium, and high, you see numbers, these can be large impacts or they can be minuscule, am I correct? I mean, they're not, they're varying degrees as far as how they affect the system, is that right?
Correct.
Ms. Gray Jackson has a question also.
Thank you, Mr. Chairman. Probably because I used to work at MLMP for a stint. Could you talk a little bit about the risk with FERC and tell folks what FERC means? I can do it, but so can you. Thank you, Mr. Chairman.
So FERC is the Federal Energy
Regulatory
Commission.
Yes.
Right. It's the reporting process that you have. That's a requirement in your utilities of the cost to your consumers and reporting that cost.
If I can follow, Mr. Chairman, I wanted you to talk a little bit more about the risk with FERC.
If you'll bear with me, we're going to
I would
get
think that's
to that.
deeper into the
I'm going to
presentation by
get
unit.
deeper into that point.
Okay, thank you. Thank you, Mr. Chairman.
Good question. Go ahead.
So this first slide, it talks about, at a high level where the risk lies. And I'm going to stand up for this a little bit, so I apologize to those who are following me around. So we talked about what the indicators are. If we go over to finance and logistics, if you look at the finance and billing, the main area inside SAP, we have the yellow triangle, which means there's some medium risk there. From an overall perspective, that particular area in the system is at medium risk. And you can see we had 23 green checks, which you had 23 low risk, you had 15 yellow, and you had 3 that were red. So definitely you want to address the red and you want to address the yellow. And we'll get into some of these high risk areas in just a few minutes as an example of some of the high risk that we think you should be aware of. All of it is in your book, but we can't go through the whole book. So we pulled out what we think are some of the key findings and key risks. So if you look at logistics and inventory, it's at a medium risk, and you can see that the green is 3, yellow is 6, red is 4. Grants, we feel, is at a higher risk because you had more subtopics that were at a risk than you did as far as yellow or green. And some of the impact to those red had a higher risk to them. So that is red. Project systems, it's sort of in a yellow category, well, it is in a yellow category with 4 of the medium risk, 1 in the high. FERC, which is your Federal Energy Regulatory Commission, is red, and we'll get into that. And you'll see, and you're going to say, well, Norma, why we only have 2 that are red and 3 that are yellow? Wouldn't that be a yellow? Well, the 2 that are red, we feel had a significant risk to them to cause this to be red for you. And you'll see the same thing over in human capital management. You'll see that we have it rated as red, high risk, from an overall perspective. 24 of those subtopics were yellow, and 7 of them are red, but those 7 are significant to you. And so we rated that as a high risk. And you'll see down in security, data, testing, reporting, integration and master data, project scheduling, and your business warehouse, this is your reporting area, we've rated as high risk also. Any questions to this slide?
Nope, doesn't appear to be.
I
Oh,
have a question.
I didn't see you raise your hand.
I didn't, but I am now.
Okay.
Thank you, Mr. Chairman.
Ms. Ray Jackson has a question
And I
on
don't
this
want
slide.
to be, I don't want to be negative because I'm probably one of those cost people I know, but I'm looking at this spreadsheet. Is there anywhere, and I'm not going ahead, anywhere in this presentation where there are other, anything, any good? I mean, everything is low, medium, high, which are issues. Are there anything good?
The green checks are good.
Well, it may produce a minor impact. I mean, is there anything that is not gonna, is gonna be just plain old good? And I don't mean to be rude, but I'm just like.
There was,
I'm looking
yes.
at this. Okay, all right, thank you. Thank
Again,
you, Mr.
they're
Chairman.
inside, the detail of all that is inside your book.
Okay, thank you.
Go ahead.
Okay. The next slide talks about some of the common risk areas that we found across all of those areas that we assessed. And I told you I would bring you back to this circle, and I want to do that. But let's talk about some of those common findings that we saw across your landscape, your SAP system. And the first thing we saw across all the areas that we assessed was the missing project artifacts. So if you remember, I talked about, you know, your blueprint, your documentation, right? We're missing some of that critical documentation that you need to document and artifact your system. So you can use that to help train and to help move forward later on when you go live. Also, some missing artifacts around the functional and technical specifications, which will help you to move forward and to understand where you are and where you're going. And also the documentation around testing strategy.
On point number 1, Ms. Johnston.
Documentation, back when we had the 2012 Q&A and we brought Peloton in, my understanding was that Peloton has done quite a bit of documentation. So is that part of Ms. Ray Jackson's, there's some good out there too? I mean, Are we completely lax of documentation, or is this a variable lack of documentation?
Yeah, you're not completely void of a documentation, but there is a large gap of documentation. There is also design and
On
configuration.
point one, Ms. Dembowski.
Yeah, just because their name just came up, where is Peloton? Where's Wayne? Oh, you're representing Peloton? Okay, thank you.
It's not here anymore.
Okay. Thank you.
We found across the areas that we assessed that there were design and configuration issues, which we're going to get into later, and just right after this page, actually some of the details, some of the key, a sample of the key findings that we had. Incomplete data conversion, so what type of data are you bringing over, how are you bringing it over, when you bring it over. Also incomplete testing as far as what do we test, how do we test it, when do we test it, how do we just test this little piece like accounts payable, but then how do we test the whole integration from beginning to end that impacts accounts payable and the input and output of that. Incomplete report definition, also knowledge transfer. At this point, we feel that there should be more knowledge transfer that's been transferred to the municipality. So when everyone is gone at the end of the day, you will know how to run your system, and that's important. Also, we found that your software and hardware is not current, it's not up to date. So there's releases that you need to do every so often to bring your software up to date and your hardware up to date. We also found that there's a tool that SAP has called Solution Manager. You have that tool, you're not utilizing it at this point. And that's really where you keep your documentation and you keep your configuration documented. So if SAP, from a technical support, if you had an issue with the product, they could come in to Solution Manager and see where you stand. And they use that tool. So we feel Solution Manager is important.
There's going to be a few questions about this topic. I have one for certain. Mr. Trainee.
So are you going to give us a list of the software and hardware that's not current? Because that affects how we can use your program. And I'm wondering why IT has not been on track on this thing. And you're saying they're not using Solution Manager. Is our IT making a mistake there? Or what's the problem? Because we buy a lot of software, we buy a lot of hardware. So you're saying it's not current.
You might have to go right to the report findings on that answer.
I know, but I've got
No,
it here.
I wanted to.
$306 an hour, I've got it here.
I got you. No, I wasn't saying you. Norma, you might have to go right to the findings in the book. What's the answer to that?
We'll have to go to the findings in the book to get the answer to that.
Well, you're the manager, look it up, because that's critical to the next couple of questions, and I'm not being rude here. We've got to know that.
If I may, Mr. Chairman, we have a report that is being drafted that's nearly ready for issuance, which will provide you a detailed assessment of the software and hardware status of SAP and all the associated. In answer to your second question, the Solution Manager is a piece of software that we acquired, and it is standard operating procedure that our integrator would use that as the source of maintaining the documentation. Our original integrator did not do a very good job setting it up. It was very difficult for our staff to use, and thus it was not used fully in the implementation. There are parts of it which are being used, and we have also underway at the instruction of the mayor drafting a document as how we're going to refine our use of Solution Manager.
Keep asking your question, Mr. Trainee. I think you still got to go. Maybe
Ms.
Lance has to
Guyard,
give
so
you.
when is this report and the solutions going to come forward to this body? Because routinely, the
yes, sir.
administration brings us wish lists of things they want to buy, we support that. But I find it odd that our software is not up to date and our hardware is not up to date. And we've not been hearing anything from the IT people.
Yes.
There's a problem.
Mr. Chairman, as the project sponsor, I can tell you that it's very challenging to upgrade software in the middle of the implementation. And this implementation has been ongoing since 2000, I think we are the 2010 version of the software. To stop and upgrade is a very big challenge in the middle of an implementation. However, as a result of this QA,
we are proposing a plan for the mayor and the administration and the assembly to look at when would be the right time to get up to date, because we know we do not want to go live on an old version of software.
Could we get that report in a week or 2 weeks? I want a date on getting that, unlike SAP going live.
Yes, sir.
I can get this from you, I want to know when we're going to get it.
Mr. Chairman, that report is fully drafted, but I haven't had an opportunity in the last 2 days to go over it with the mayor. But as soon as the mayor has an opportunity to look at it and feels comfortable with it, we would be happy to release it. Certainly, you would have it by the 27th of February when we meet again.
Good, thank you, ma'am.
Ms. Dembowski, go ahead. And then Ms. Johnson.
Thank you. 2 questions. Question number 1. The software and hardware is not current. You said it's in the report. What page in the report?
We'll look it up for you.
Yeah, and then get back to us. Ms. Greg Jackson.
Thank you,
and then
Mr.
Ms.
Chairman.
Johnson.
So, the software that we're not current on, you're talking about SAP, correct?
Yes.
Or, okay, yeah, we don't have the current version of SAP.
Correct.
Right, that needed to be clarified, I think. Okay, so then when we talk about solution manager, is that the same as project tracking?
No.
Okay, I just needed to know that. Okay, thank you. Thank you, Mr. Chairman.
Ms. Johnston.
Just before we get too bogged down in this, the software and hardware upgrade is more of a business decision. Am I correct? I mean, whether you do it before you go live or whether you do it within the time of your that's the word. But in other words, you want to do it within the scope of the project when it is the most effective. Is that correct? And so you're raising it as maybe an issue that we need to look at, but not necessarily, I mean, the timing is everything, and it is a business decision. Would you say that?
It is a business decision, but it is an SAP recommendation that you keep your software, SAP software, up to the latest release level. And it's our recommendation that you do that before you go live.
Before you go live, but not necessarily as you're working on the project.
Well, you would need to do that now. You're going to need to schedule time to do that now before you go.
No, I know.
Before we get bogged down.
I'm not going to get bogged down, Ms. Johnston, but I'm certainly going to emphasize the point on this because, you know, and I take a lot of responsibility for this because I've been with the body from the beginning. So the newly elected perhaps are inheriting the decisions that I made, and throughout that, I've seen appropriations come through for latest version. I use Windows XP, so I'm not a candidate here, but Lance, we had October, November, you came to the assembly body for upgrade version appropriations, and I remember SAP being in there because I raised the question is that we haven't even implemented the first version yet, and you're asking us to do that. What's your take on that? Are we covered financially, or where are we going to go? These are big numbers.
Through Mr. Chairman, we
Yes.
came forward to you for maintenance and additional licensing. We did not at that time come forward to you for an actual software upgrade. And we are building that, but we just don't have it ready for you through the mayor at this time.
Well, and I'll be blunt, one of the conversations I had probably with myself was the ability for SAP to analyze their own software and the purchases thereof. And so here we are in a place where the vendor is recommending the vendor's product, and I want to be very cautious, no insult to SAP, but if it's necessary, to always have the latest and greatest. You would want us to, no doubt, but again, and I'm going to be really cautious here as we continue to buy, if we can't even get out of the blocks.
Yes,
So Mr. Trainey's on task with the report, but it's what do we do with that information, and that may be something you're going to have to visit on the 27th.
Mr. Chairman, I appreciate your question because I think we need to provide a little bit more information on what the costs are to you of an upgrade and what does upgrading mean and what does maintenance mean, and we'll incorporate that. Thank you.
Fair enough. Well, and it isn't getting the weeds, Ms. Johnston.
No,
I
I'm
think
just saying it's a business decision.
Doesn't matter.
Financial decision too, to a degree. From
Maybe a quick clarification.
Please do.
Yeah. So when you take a look at the software itself, at the versions that they're currently at, there is a process that you're under the maintenance agreements that you have in place. Those upgrades are part of that maintenance agreement. So there's no additional software. It's just making the actual changes. So if you're on version, ABC, you need to be on version ABC 0.4.
Okay.
That just has to, the actual work has to happen. There's not additional software that's required to get to that upgrade. So I just wanted to pass on that clarification that there's no more, at this point for the software that's in place, additional funding that's required. It's just the actual work that needs to happen to make it happen, to get to the upgrade.
And I don't want to belabor that, but it goes to what Dombrowski was saying, is that, and ignorant because I tried to read the report, but that finding number 7 is where in our book? How do
It
you?
is 3.17.
3.17.
I'm
Page
sorry,
317.
page 317, I'm sorry.
That's what page I was on, I thought so, I just want to make sure.
Okay.
Page 317, sorry.
That's the page that's virtually all red, just FYI.
Yes. Okay, I'm happy to have that throughout, but it may need to be, so we can study this effectively on your comments. We might need a little primer on how to read the report, if it's not easy. Anybody else? Ms. Gray Jackson?
Thank you, Mr. Chairman. I just want to say I appreciate Ms. Johnson's continued comments that it's a business decision, but it's the business of the city also, and I just needed to make that point. And on top of that, my other question is, so the software was, well, the project started in 2011, and it's now 2015, and I'm still on the software upgrade. Between 2011 and now, how many times has the software actually been upgraded, or has it not been since? So it hasn't been. Can you say that?
I don't know if we looked at how many times it's been upgraded or not.
Has it been since 2011, since the project's implementation?
I have Lynn Ketchy who would help.
I don't care who answers the question, but I really would like an answer.
The finding was is that the versions of the software that you're currently on are from 2011. Oh, sorry.
Right.
Okay, sorry.
Yeah.
So that was the version of the software that you're on is 2011. Since SAP regularly provides enhancement packs or support packs, and some customers apply them like once a quarter, once a year, they do the upgrade, but they have not been doing that as part of the project.
So it's sort of like Windows updates, but not an upgrade.
Yeah, it's like
All
something
right.
you normally
Okay.
do.
Right, all right, but no upgrades since 2011. Okay, thank you.
You're welcome.
Thank you, Mr. Chairman.
Excuse me, Mr. Chairman. SAP has upgraded its software and has issued a brand-new release of its software. I'm not sure that you got the answer you're seeking. There is a full upgrade of its software that we are looking at, and that information will be included in the report.
If I can follow up, Mr. Chairman, thank you.
Well, I don't want it to be an argument.
It's not an argument, I just
Yeah.
want to follow up.
Yeah, I can read you the finding.
Let me finish.
Sure.
Thank you, Ms. Guard, but what you just said answered my question. It hasn't been upgraded yet, but there is an upgrade coming.
Thank you.
Thank you, Mr. Chairman.
Go ahead.
Okay, thank you. So I just want to bring us back to the circle where we talked about.
Well, if you could do 8 and 9 and then bring us back to the
Okay,
circle.
sorry,
I think.
8 and 9, no surprise to you all, right? Resource issues, lack of having enough resources. And then 9 being a project schedule, not having a fully integrated project schedule with the discipline to maintain that. And if you remember, that brings us back to the circle with the things that I talked about that are common findings. And these are common findings within the municipality also.
Yeah, now just as chair, as clock watchers here, we're going to extend a half an hour on this work session too, so pace yourself if you need to add some more time to your deal. This is important to us, so. Mr. Trainee?
Ms. Guard, what's the cost on this new upgrade? Is it free from SAP, which I doubt? Is there a cost associated with it? How much is it?
Through the chair, Mr. Trainee, the cost associated with the software upgrade has to do with the resources that we would need to bring in to configure that upgrade and to help us put that upgrade in. And we do not have a number for you at this moment. The software itself, however, is covered by the maintenance. So we receive those upgrades as part of our maintenance package. We then have to incur the cost to do that upgrade. And as you will recall, I believe, Mr. Trainee, we were on 7.5 of PeopleSoft. And in 2003, the then assembly was asked to upgrade to 8.0, and PeopleSoft gave it to us and decided not to. So this is the type of thing we're talking about. It does take resources, and I believe to do that upgrade at that time was a couple $1 million. I don't know the cost, and we'll be working to get you that information by the 27th.
Ms. Dombrowski on point 8 or 9.
Yes, sir. Thank you, Mr. Chair. I'm sure I know the answer to this, but for the record, I just want to hear on internal resourcing issues. Are you specifically saying lack of staff? Is that it in its entirety? Lack of staff, internal staff to help with
Lack
the
of
project?
support for your staff to support the implementation, the actual implementation.
On 8 or 9?
Yeah, MOA staffing or consultant staffing?
It was related, it was both, but it really relates to MOA also.
Go ahead.
Okay, thank you. So the next several slides, I think there's 3, 4, 5 of them, really talks, we pulled out of your book some of the key findings with the assessment. And these are really the red triangle, the high risk. We're going to walk you through some of these. We can talk about each one of these as long as you would like, or how much you want to get into these. But Lynn Ketchy, who helped manage the assessment, and the consultants that were on site and as part of this presentation, will walk you through these key findings that we pulled into this report. If you have the complete set in your book.
And just for those that just got it this morning, where is that in the book? What page are you on?
So,
I'm locked here.
all right, the way we did this, and I apologize, we probably should have put pages. We put the actual number, so in your table of contents, 5.8, you can go to 5.8, and then that will point you to where it is in the book.
122.
Okay, so 5.33 is 33, and this is 5.8. So, gotcha. Okay, go ahead.
All right, Lynn, would you like to talk about the first finding?
Yeah, so actually the first 2 findings are related. There were some questions earlier about Kronos.
Yes.
And so we did not look at Kronos, but we looked at the impact on the SAP side. And so from the SAP side, you know, what we see is there's 4 different collection subsystems for the time entry, and this presents multiple points of failure for the data coming into SAP. And the other thing is that there's interventions in the data that's going into Kronos, which would make it hard to do what we call the parallel testing, and that's going to be critical to make sure that your payroll is accurate. So that's this first one, like enter or correct the time. So like if you run an SAP payroll and there's an error on a paycheck, you have to put the correction in on the SAP side, and then you would have to go retroactive back to Kronos to put it in. So that's a point of failure, right? Do you? Yep. Okay. Question?
Yeah, expound on that, Mr. Trainee, if you'd like.
On Kronos, do you have a version of Kronos that you know is not laced with bugs, that works, bring the data into SAP? And I want to make sure we've got the correct version of Kronos. Because if we have a failure there, then the data that flows to you is not going to be correct.
Right, so Kronos isn't our product. So on the second
But
one.
does SAP have a version they know is error-free or bug-free?
SAP, we have what we call the CAT system, which is what we use for time entry, and we often see Kronos being used as what we call a time collector. So like the where you punch your cards, right? You're collecting the time. Here at the municipality, they're using Kronos to help evaluate the time, and then that's passed into SAP, which creates more complications. And so that's on the second one down there, that it says time evaluation will be split between the 2 Kronos time collection systems and SAP. So the recommendation in there is to consolidate these time evals, we would like to see it be a time collection system, but we're coming at it from an SAP perspective. So the bottom line is a single consolidated stream of time data coming into SAP will be recorded.
Because when I read down here, you've got to bring Kronos time evaluation up to date. So I want to make sure we've got the right data flowing into SAP, or that interface is not going to happen.
So what that means is that when they were actually doing the interviews, they found that Kronos did not contain all the time evaluation rules necessary for the union, and there was an intervention taking place. So things were being printed out, and then people know what these time evaluation rules are, and then they're manually putting it in.
Thank you.
Sir, if I can address that to some degree, it's the same issue we talked about before about keeping the versions aligned. So there are versions of Kronos which are tested against versions of SAP, and we have clients who make them work all the time.
Can you give that to the city so we can check with?
Actually, that should come from Kronos.
Okay.
They test against our software.
Okay, it's not you telling us what Kronos, we need Kronos to tell us what.
Exactly, they integrate to
Thank
us.
you, I can get that.
Mr. Flynn?
Obviously, we have different bargaining units that have different timekeeping rules. Is that what you're getting at, or is there some other aspect of this that, of the way Kronos operates that is causing a problem?
No, we have different state and locals that, where I've seen up to 22 different unions, and SAP was able to process the payrolls. So it's not the number of unions or the complexity of the unions. Does that answer your question?
Somewhat.
But
Sounds like,
I
is
think-
it a data in?
I think your original point was, you've got 4 different software systems collecting time, that's where the problem is.
Exactly.
It's not the complexity of the CBAs or the work rules, it's basically you've got basically dysfunctional time collection, we want to consolidate. Is that a fair statement?
Yes, that's exactly. We need a consolidated stream of time data coming in.
I have a practical point here, because Mr. Flynn's raised a question, Mr. Train's raised a question, I'm going to raise a question as well. Mr. Mayor, you've had a habit typically of kind of working with us. Today's a great example of that. How do we reach common ground on the implementation of the solution that's recommended? I mean, what does that look like in terms of public debate and public discussion? We can certainly empower you as an executive branch to go do it, but you're going to ask us for money to do it. So here we go. You know, we're mature legislators here. How do we get past obstacles that we disagree, perhaps with a recommendation, or what's the way forward? You got a minute to respond?
So I mean, that's going to be the next phase, and on February 27th, we're going to present you with our go-forward plan.
Okay.
And I think as we go forward, I think literally the partnership between the administration and the subsequent administration and the assembly, because this is so important, probably needs to be more dynamic and more interactive, because we have to have a success here, and we're at that critical point where we cannot have enough communication. So you'll see the plan. There'll probably be kicking the tires of that plan like there is with any major project, but I think given the strong recommendations we have, we're inclined to probably follow most of those, certainly the hot button ones, and seek your support.
All right, well, honest answer, and I'll, whatever I can do to foster that. I'm not sure I want to take full responsibility for that, but Ms. Johnston?
Just a question as far as this integration between, and let's just go with Kronos. Currently, in this process, have they been programming the data entry and the data management from Kronos into SAP? Maybe not with an SAP program, but is that being integrated at this point? And did you look at that, or did you just say that you weren't sure about that and this is a more efficient way to go?
We looked at it from the perspective where we didn't look at how Kronos is configured, because Kronos was outside our scope of work. But we looked at the fact that Kronos is configured to do what we call time evaluation, and then that data is being passed into SAP where there is some additional time evaluation happening.
So you looked at our process now from going from this data to data integration to...
Yeah, we looked at it from Kronos to SAP, and then inside SAP, what's the likelihood of you having successful payroll runs? That's what we're really looking at.
And what we're going to probably have to do from here on, I think, is sort of stay high level or at the presentation of the solution, and then we're going to have to dig into that, as the mayor mentioned, perhaps between now and the 27th or on the 27th for those actual. Those are great questions, but I certainly don't have the time to go through however many of these you're going to example us today on, but keep going if you wouldn't mind.
The next example is on page 132, and it's for the topic of organizational management, enterprise structure. And when we were here in 2012, we looked at the organizational structure, the enterprise structure. And remember how Norma said that there's green, yellow, and red? Sometimes the greens are, okay, But sometimes the green are a low risk. And if it's a low risk, you can tell because in the recommendation it says, you know, be careful about this, right? So we don't want it to go bad on you. So in 2012, there was a low risk on the enterprise structure. And when we came back this time, we saw that there had been a lot of change. And in the organizational structure, it's like an intelligent key, like you see in the computer system where you have to enter a particular code, and that particular code means a certain thing. Well, that's what's happened with the organizational structure. And the organizational structure, it's an important component within your, not only your HR, the HCM module, but it also crosses over into SRM, which is your procurement area. So remember, you saw all those different modules within SAP. There was the slide that said business processes, and it came down, and then there's the boxes for SAP. And we were talking about the master data, how everything is integrated. So this is one of those areas where it's an integration touch point, and it needs to be corrected.
Ms. Geyer, your last meeting, you tendered us sort of an org chart or a presentation that included some subcontractors. And do you feel comfortable that the recommendation is part of that presented solution? Or when the recommendation is an experienced consultant thereof, are we already equipped in that capacity, or do you feel like in this recommendation we have to go outside again?
Mr. Chairman, we will be making a plan just specifically for that recommendation. We believe with SAP and our Peloton consultants that we can address that issue.
Okay, let's move on then to 3 of 5.
To the next one is page 182. So again, go back to that one picture that Norma showed where all the boxes were on. And SAP has a product called the SAP Business Warehouse, and it also comes with the SAP Business Objects. We're on page 182, the general design concept for SAP BW. And the SAP Business Warehouse is what you use for reporting. So it's going to be really important to you. So it pulls all your data together into a data warehousing environment so you can do reporting. And what we found was that there's something, we call it a layered scalable architecture. And what it really means is that you bring data from different systems and you're starting to compile it, aggregate it, right? And it needs to be compiled and aggregated in a way that's highly reusable, because we don't want you to have to do a lot of rework, and we want your data to be accurate. And we found that there was no layered scalable architecture. And the other thing we found, it's like when you write something in Word or you create an Excel file, a lot of times you save that file name with something that's meaningful so you know what it is. And within BW, we use standards to indicate the different layers of the data. So like, is the data like in a native raw form, or is it aggregated maybe at a cube that you would be reporting against? And we found that there's no standards. The standards do not exist, so it was very hodgepodge. So that's something that needs to be corrected from a sustainability point of view.
Without trying to maximize the meeting and my questions, Mr. Mayor, the enterprise activities are by themselves sort of unique to their own ML&P, AWW, for those that I'm talking about. Does that complicate this finding from the, trying to put them into the system now, or would it be a recommendation that you would say, let's back off on AWU and ML&P and get the basics done first?
I think the common theme here is the sooner that we get everybody into one system, the more efficient it's going to be. It's almost like you have to make that commitment up front, because if you keep trying to piecemeal it, there'll be different assemblies, different administrations, and you may never fully integrate.
Fair enough. I appreciate the answer. It just seemed to be your observation was the ability to define under universal definition, and it would seem to me that you're trying to, compare oranges and apples. But I appreciate that. Maybe more on the 27th on that scope as it relates to the schedule. Mr. Flynn?
Yeah, Mr. Chairman, just a little context for some history that you, I'm sure, recall. At one point, there was a proposal that we advance 2 ERP systems, one for municipality and one by one of our enterprises. And I did a little research on that. It seems, if I understood what I learned correctly, the germination of that was that the enterprise would go first and everybody else would follow. And when this administration decided that the municipality would advance that, for some reason the enterprise was unwilling to let go of their project until we kind of gently nudged them off.
Told them to, yeah. Okay, well, I appreciate the history lesson. I kind of knew some of that dynamics was there, but between the answers, I think it's another area where we want to expand the realities on the 27th.
Mr. Chairman, you bring up a good point about the enterprises and stuff. So one of the things that has made, I think, this project more challenging than probably our first system integrator understood was the fact that we do own utilities, that we have, service areas, that we have 150 different ones. Probably, I'd say, one of the more complicated implementations that anybody's going to encounter in putting in a new software system.
Yeah, no, I appreciate the global reach. We just want to also make sure that we make some milestones. So that I didn't put it out there as an area that I knew the answer. I just think that it might make sense to think about it.
Oh, Mr. Chairman, just to make a point, Mr. Mayor makes a good point, is that by being a municipality where you have the city and you have utilities, you're doing both of those at the same time. So you're in effect doing two implementations at one time, right? They're being integrated, which is great, but that does add to the effort that you're putting in there because you are doing both of them at the same time.
Well, I get that, and I'm not here to debate you perhaps, but it also is complicated because you have separate financial people that lead and direct those separate purchasing departments, and you're trying to bring a lot of people to the table under perhaps aspects that just don't fit in that box, a spherical square concept. But again, I'll study it and look at the history of success if there is any. 3 of 5 are we now?
Yes. So the next one is about the payroll process itself. And
Page 117.
Thank you.
And when the consultant went in, when we looked at the system, we found that there was a high level of customization. And one of the areas of concern is the Kelly shift. And we saw customizations there. And so the complications between Kronos and then the customizations is making it very hard to do the Kelly shift. And Kelly shift is not something unique to the municipality of Anchorage. We have implemented Kelly shift at other state and local environments using standard SAP. So this is an area that we'd really like to see researched and corrected.
Mr. Trainey, to a question on this?
In those areas that you've seen it used, have they used Kronos to bring the data into SAP? Have they used SAP?
I don't, Rich, you may be able to help on that. I don't know. I don't know.
Mr. Chairman, I could perhaps help. Mr. Attorney, SAP does not have a time collection system. They always bring data in from somewhere, and then their system calculates the payroll.
Yeah, we actually, like sometimes we use CATS, and some of the state and local states did use CATS to bring the data in and evaluate it, and then the Kelly shift was applied.
And I think again, with the
A lot of CATS.
with the idea that we're going to herd cats on the 27th again, I think the idea is that you have to analyze the suggestions by the auditors as well and comply or tell us how you plan to implement it. And Mr. Trainey raises a good point about we also have that other investment that we've made in Kronos, and we want to preserve that. That's an opinion, but we would certainly want to consider the investment we've made to date. And then the FERC,
I'd like to answer.
please.
On the FERC, the reason that FERC is red.
Page 220.
Page 220? The reason that this one is red is because the FERC really hasn't gone through what we call the month-end process yet. So from a testing perspective, really testing it fully at the month-end process. And until that's done, there's a likelihood, a significant likelihood that you may have something configured incorrectly, And FERC is critical to making sure that you get your rates set right, so we want to make absolutely certain this is correct. So we don't want this one ignored, okay?
Yeah, Mr. Flynn, I'm sorry, go ahead.
I mean, we're generally not FERC regulated. We're RCA regulated. So how does this module reflect that differential?
Let Glenda answer that question.
I can actually answer that question. My name is Glenda Gibson. I am the Finance Division Director for Anchorage Water and Wastewater Utility. And when we refer to FERC in SAP, it's kind of a general term to cover our regulatory reporting. It will cover all of our RCA reporting for both AWW and MLMP. So it really encompasses both our requirement for MLMP to use a FERC chart of accounts and AWW to report using a NARUC chart of accounts.
Mrs. Gray Jackson, please try to make it into a question.
It'll be really, really quick.
Question.
Thank you very much for your comments because, and I think maybe everybody knows this, but general government accounting, chart of accounts is different from the FERC chart of accounts. Thank you.
I have an observation, and this one seems to be your illustration that there is no test method or we haven't tried it out yet. Your observation that you're likely that it seems to be the wording is that you feel it's going to fail already.
We don't know that it will fail, but this is a significant area that cannot be ignored, okay? So it's very, very important to test the FERC with full data from the full month end, and it happens at the very end of the cycle. So until this is fully tested, you don't know. You don't know if it's going to be right or not.
And back to the old definitions, it's on the FILO side then, am I being ignorant or that? So when we talked about in past observations trying to get ramped up on where we were at with this recommendation to do that, I thought that FILO in my hearing was we were maybe 90% there or whatever. Is this the last 10%, Ms. Guyard, do you think?
Mr. Chairman, there are several modules within FILO which are very close to being ready, have go-live readiness. What FERC is not one of those modules.
Okay.
It is a module.
All right, good answer, thanks. Would you have a question?
I do. One of the things, and I think it's because you're focusing on just one point that you pulled out of your report, and since I got this 5 minutes before we started, I'm just looking for it now, but a common theme that I see in the payroll department, it's clear the payroll team didn't understand how garnishment works. You know, it lacks steps to define what to do when errors are found. There's consistent references in here during the payroll department. They don't know what to do, how to fix problems. They don't know how garnishments work. They don't know how overpayments are going to be fixed. So a common theme that I'm seeing that made the book but didn't make the presentation.
It did make the presentation up in the earlier slides that Norma was covering, where she was saying that the design artifacts, we don't have design artifacts, they need knowledge transfer. That's what this is referring
Okay, so
to.
I have a hard time with general statements sometimes, so getting into the meat of it, that is a big problem that you did identify in your audit throughout.
So it's like in your inventory procurement, in different areas like accounts payable, in payroll, so it's across the board. I think that there was one area where it didn't really apply.
So essentially, we really need to make sure that there's real training and that our employees understand how to fix things, what these things mean. You are finding that in your review.
Correct, and that gets back to the question about the upgrades, because when the municipality's employees understand how to do this, going forward, you'll be in a better position to sustain the system because you'll be able to upgrade it yourself without having to get.
And I appreciate that clarification, because when we hear a lot of these terms, I know it's very it's standard for you guys, but for us, when we hear it, we have to be able to relay it to others. And so when we recognize that we have a deficit in our the knowledge we transpose to our employees, that needs to be highlighted so we can understand how to correct it.
And I think really, try to move it on, that'll come at the analysis of the executive branch suggestion on what do we do and where do we fund it. So the defining lines is what I believe will be the case on the 27th, is how do we analyze that and give authority or not to the executive branch plan forward. So I like the illustration Ms. Dembowski put out there in terms of continuing research. So as we hear what the administration's going to do with that finding, I believe that's when the conversation can better happen. It'll also have a price tag, I hope. You want to move to the 4? We have about 18 minutes.
Okay, the next one would be in the area of accounts payable. The item that,
Which 38?
What is it?
38.
Okay.
so on this item, what we'd really like to highlight is that most state and locals, they have workflow in the area of procurement. So how something gets procured and the different approval processes that it has to go through. And we typically see a workflow to get those approvals done. And here, the workflow was deferred. And that's why this one is being highlighted, because we believe it needs to come back. You guys need to evaluate that. And
Ms. Gaillard, if you had assigned responsibility to that internally from a government perspective, who would be in charge of this finding?
Mr. Chairman, the project team determined that the workflow that was created was overly burdensome and took it out of scope. So SAP is requested to put it back in scope.
And back to the org chart, they gave us that at the last meeting. Are we already equipped to do that, or is this going to be?
It's going to be part of the shoring up of the system that we're going to be doing in the future, and there will be a plan that supports that effort and associated costs.
Thank you.
so the next item that I'd like to talk about is cash management. This is another area where typically we see cash management in state and local.
Page 78.
Page 78. So you had cash management, you started with cash management, but then somewhere along the line it was taken out of scope. And we're not really sure when it was taken out of scope. Remember the change control that Mona talked about in the circle, how it was real important? We don't know when it was taken out or why it was taken out, but we know it's not there. We know that some of the configuration, it's done. But it hasn't been tested, so we'd like to see this come back into scope.
And I want to be clear, because it touches me in my responsibility fiduciarily. This is a finding of the software program and not the current practice of the administration in being lax in cash management.
No, this is not.
So let's please be clear. You know, we're good at keeping track, Mayor, I think. So let's remember it's the program we're asking it to help do it too. Thank you.
The last slide is about project scheduling. And in the area of project scheduling, typically there's something we call it a project scheduling management plan, and we don't see any methodology on that. So that says, like, you can only have a task you can't exceed a task cannot exceed 40 hours. All tasks have to have predecessors. So how you organize the plan and how you go about getting.
Did I miss the separate report?
I'm sorry, Mr. Chairman, we just realized that in our hurry to print this report, we forgot to print that report. It's not as voluminous as this report, but we can get it out to you on PDF, on electronic means later, and we'll get you a hard copy. Apologize for that.
This is an implementation of the solutions as suggested, though. This is keeping SAP overall implementation on track, and you're talking scheduling, right?
That's correct.
Okay.
This is just from a scheduling point of view, scheduling the project. So, and remember on the circle, there was the piece about, like the human management, the people piece. And a lot of times a project, it won't have enough people. And we have, typically a project, we'll have a schedule, a project plan. We have a resource plan, so we can see, do we have enough people to do the work? If you don't have enough people to do the work, then you take longer to do it, right? So it was missing the resource loaded schedule, so that piece was missing.
Ms. Johnson, elaborate on that, would you, with a question or some other statement?
That's a question.
Go ahead.
So, since you have done a number of public SAP projects, is this a standard, IT projects tend to be hurry up and wait by sometimes.
Oh, hurry up and wait, that's how you keep the project schedule up to date?
I mean, it just, you're right, your programmers are doing this, the people are waiting. You get to the point where now you bring in your municipal resources because the programmers are done. You input, and then there's another program problem. I mean, am I wrong that there is a lot of hurry up and wait? But in the public sector, we have public employees who have other jobs. So when you talk about project scheduling, how in other municipalities, states, or whatever, where you're constantly pulling your human resources in and out of the public sector positions to provide the integration?
So typically, remember we're comparing it to best practices, right? So the best practice in state and local, city, state, is they actually backfill the position. So we have somebody from payroll that is allocated, 100% to the project or 75% to the project. So that person isn't getting pulled back and forth a lot. And then the hurry up and wait piece on the best run project, so you have the schedule, and the schedule has all the dependencies on it. So if something is slipping, you're statusing it based on remaining effort, and you can see the flow throughout the project schedule, like what's it going to be impacting, and you actually know what the real go-live date would be.
So just to follow up, because we've heard this all along with this project, is that the backfilling of public employees or somehow getting the public capital into the project has been an issue, and you've again found that that's an issue.
Yeah, I'm not so certain that I would analyze it as the only cost. When you have a company like Black and Beach kind of fall off, your schedule change there too.
Yeah, but I'm just saying that I've heard this thing.
Yeah.
The last one that I want to bring up is where it says the schedule management is undefined. So typically, the best practice on a project is we call them like a project scheduler. There's actually somebody that's dedicated to making sure that that project schedule is up to date, current. So, Ms. Johnson, if you wanted to know when is this project going to go live, you could get it off that schedule. So.
I'm going to spend 10 minutes kind of just recapping where we feel like the way forward is going to occur. Is that your job, Mr. Mayor?
Yes, it sure is. Thank you, Mr. Chairman. Well, we certainly appreciate the work that SAP has done. It's really given us, I think, a clear blueprint. We think there's probably 6 major areas that they've identified. Certainly project management and governance, data conversion, the SAP configuration itself, project staffing, scheduling, documentation, and testing. And we're committed with a go-forward plan that's going to address all of those areas. And I think first and foremost is we have already established a new governance model that you saw from the CFO several weeks ago. The Executive Steering Committee consists of Dennis Wheeler, Kate Guyard, George Vacalis, Nancy Ucera, and then our external advisors, Diane Thompson from RDI, Tim Gerhardt from SAP, Rich Bakes from Peloton, and Ann Reed with the MOA, as well as Larry Baker. So they're the executive committee, kind of the policy directors. But then there's a functional steering committee, and these are the people that will certainly be more hands-on with directing the workflow. Includes Glenda Gibson, who spoke earlier, our controller Tom Fink, who's in the back, OMB Director Marilyn Bonzoff, our treasurer Dan Moore, who's here, Rick Miller from MLMP Finance, purchasing director Ron Haddon, Karen Norsworthy from ER, Lance Ahern from IT, Jacqueline Hofflich from Benefits, and then external advisors Matt Johnson from SAP, Tom Fisher from Peloton, and again from MOA. I think it's really important that new structure was put in place because, again, I think that was one of the weaknesses before was just really a lack of good overall project management.
And I didn't mean to interrupt your presentation, Mayor. I did on purpose, though. I remembered it. I've referred to it several times. Did we approve that? Was there a price tag with that? Because RDI was part of the conversation, the extension of that. That's that. You're saying that that's already in place, Mayor, or is that something that we have to consider?
No, the contractors are in place and.
Okay, just.
Excuse me, but the committees now, you've redefined some of the committees. That's somewhat different than how it has been in the past.
Oh, yes, absolutely.
The
Yeah.
two committees seem to be.
I got it, and I wasn't sure if there was still pending financial either. At the upcoming meeting Tuesday, there is. Right, okay. Say that again, there is an upcoming item on the assembly agenda to
Yes,
do what?
Mr. Chairman, we are asking you to continue the RDI contract.
Okay.
And then,
Can I let the mayor finish and we'll just
Sure,
wrap up?
yep. And then going forward, of course, with that project team in place, developing a schedule and financial projections so that you can get a better picture on just what exactly it's going to take to get to completion. Clearly proceeding with the documentation, that's absolutely necessary before we can even think about going live. Proceed with the structural changes that were identified. There's two that kind of rose to the top that are, I think, somewhat immediate action items. First, the time collection system was talked about. We do indeed want to get on one time collection system. We're just going to continue to have problems if we don't. And then, of course, the reconfiguration of the enterprise structure design itself. That's a baseline thing that has to be done, or else we're just compounding errors. So on the 27th, again, we'll have a plan that defines these more specifically. But,
From the administration, primarily today was a lot of SAP. Are you saying that 27th will look from the contractor or from your
yeah,
staff?
it'll still be a compilation of all the best ideas that have come forward, but it'll be the administration's document to the assembly.
Okay. Mr. Steele, wrap-up comments, down to 7
Yeah,
minutes.
good presentation, thank you very much. A lot of these issues that came up are issues that we all knew in terms of, as the process was going, we saw deficiencies here, there, and everywhere. The problem that I still don't see, and maybe we'll get to that on the 27th, is, yeah, we got a lot of chiefs overseeing the process, and that's great. But do we have the staffing to do what needs to be done to keep this thing on track? And if we don't have the staffing, or if their regular jobs are going to suffer because of transfer them into other staffing requirements, if there's going to need to be backfill or temporary or whatever, I think we need to know that. And in my point of view, that's where we got into trouble, was that we expected our staff to do the crossover, and in some respects they're the only ones that can do it. But and we got into trouble because we didn't have the staffing to do it, and our staff got just down in the dumps because they weren't doing their regular job, and it just got to be a mess. So that particular issue has to be dealt with.
Yeah, and I think you're right, on the 27th, that's going to be some of how they plan to do it. Mr. Evans and Ms. Ray Jackson.
Thanks. This goes to overall project management, and I've never managed any project like this, so I'm just talking, without any background in this. But what seems to me like would be great, from my perspective on the assembly, is if, and I heard the lineup for the committee and the steering committee and all that, but it always strikes me as if there was a person who was actually a single human being who was actually in charge of the SAP implement. I know you run the city and you're ultimately responsible for that, but I mean one person who I can look them in the eye and they can tell me this is going to happen when, and who I can hold responsible for that. Because ultimately we're not SAP or software people, most of us. At some level, all of our funding decisions are going to be based on sort of confidence and trust. And I think it would be a whole lot easier, at least for me, if there was one person who I could develop that trust in and say, this is the person in charge of this project, this is the person who's butts out the door if it doesn't work. So just if you can consider that.
Well, the project manager is Ann Reed. Ann, raise your hand, stand up even, so everybody can see you.
Here's your body.
Thank you.
Good answer. Ms. Gray Jackson and Ms. Dembowski.
And then what we'll do on the 27th is include the flow chart of,
Please do.
Beyond just the steering committee and the function.
Assigned duties, all the stuff that goes with that. Ms. Gray Jackson and Ms. Dembowski.
Okay, thank you, Mr. Chairman. Thank you very much for your presentation. But my question is, as of today, what percentage of the project is complete? Please answer the question for me.
I don't know that we looked at it from a holistic perspective as far as what, I don't think we assessed it that way.
Because I'd really like to know as we move forward, we have a great plan to move forward, but I'd like to know as of today. And we're moving forward, so what percentage of the project is complete? And you can estimate it, that's okay, I just would like to hear now.
Yeah, I'm not in a position to estimate it. It will
Can
depend.
somebody in this room do that
It will
for me?
depend on the outcome of the project schedule that they're putting
Can
together.
somebody in this room answer that question for me? I really would appreciate it.
I don't think we want to throw a dart at that number just yet, but again, on the 27th, as we plan out the schedule of remaining work to be done, I think we can probably narrow it down a little bit.
Okay, so today, we don't know what percentage of the project is complete.
It's just irresponsible to throw a number out if you haven't really analyzed it.
Ms. Dembowski, did you have a comment?
I have a question
Sure.
for Peloton. Specifically with regard to the findings of this evaluation, was there anything that surprises you? Are there any challenges that have been identified that you don't think you can mitigate? I just want to hear your comments in a quick 60 seconds.
Sure. My name's Rich Beggs, and I would say the answer to your question is no. I think a lot of the findings were no. Anytime you come in after an initial consulting company has been and has not followed the methodology, it's really difficult, and we call that a recovery effort. So I think the good thing that we felt coming out of the report is it did affirm a lot of the good work that has been done, but it did highlight some things and bring them into sharper focus. Documentation is an example that had been planned for after go live. I think now the municipality will reconsider that and think it is to the best of, it is ideal that that can be done prior to go live.
And just to follow up, top 2 issues that you find are going to be the top 2 things you need to address first and foremost.
I would caution that, Ms. Dembowski, because I don't know that the administration has empowered Peloton to do that yet. And certainly we're paying them, but
Mr. Starr, if I could, if he doesn't want to answer, I'm fine with that. But I think as one of the main implementers, I think if he can identify for me his top 2 concerns and areas.
we're not going to be able to do that in a minute and a half. And again, the agenda item, Ms. Dembowski, I know you disagree. The agenda item was to deliver the report from SAP, and Peloton's a whole other conversation, perhaps another work session.
Talk offline.
But
I would appreciate that.
I'll
Thank
leave
you,
that up.
Mr.
So
Mayor.
we got
I
1 minute,
appreciate your
Mr. Traney, as chairman, take over the meeting.
Okay, Peloton, we pay them $500,000 a month. How long is their contract good for?
Mr. Chairman, I just extended their contract through March 31st of 2015 to help us prepare the response plan and schedule.
Thank you.
And now,
Mr. Mayor, sorry, Mr. Chairman.
Okay, we're going to take a 5-minute break, then we'll begin the report of independent auditor. Dick, I think, sorry.
We're paying them on a time and materials part right now so that we could slim down the spend. Just to
Thank you. We'll start in 5 minutes, we're making that a short break.